Okay, very good. We are live. Now we're back, started up again. Appreciate everyone joining us back. Couple housekeeping things. We had a rule about membership participation yesterday. We changed that back to reflect management council policy. I just want to make sure with staff that representatives yesterday, I believe it was Senator, make sure he was counted as present yesterday and not excused, just to double check, make sure that's, so every member has been present both days, frankly. Okay, so we're good there. The other deal, I just want to say, we always do a courtesy after we kind of finish testimony before we move to public comment and let other members of the executive branch speak and other legislators, other elected legislators. And we have an elected official here, Chairman Dresser of the Northern Arapaho Tribe, is going to address us. I will say this, and we had 3 legislators. This is all about information. And I will be, we're in the YouTube deal. We're not going to pull rabbits out of the hat. We're not going to, and I apologize as chairman. If I'd had a big old gavel, I'd have smashed it down. But we just really want information. And as elected official, we want to give folks that courtesy. But I don't want any 20-minute campaign speeches. Life's too short. And that's for another place and another time. So with that said, I apologize to the committee. I'll do better next time on that. So I would like to welcome to the committee, Chairman Dresser. Please come to the committee. Welcome. And we'd love to hear from you. Thank you. I think one more, the light, can't see the light. There
Good afternoon. Oh, okay. Thank you. Good afternoon, everyone. My name is Jordan Dresser. I am the chairman of the Northern Arapaho Tribe. So thank you. I want to welcome you all to Wind River. It's a very trying time for all of us here. As a lot of you may know, COVID hit Wind River really hard and hit our people really hard. And so for me as a chairman, I make decisions every day to better serve our individuals. And as a chairman, I can personally say that the number one thing that we get requests for are things we need to meet on regard health and in regards are the livelihood of our people. And for me, Medicaid is something that's so near and dear to my heart because it will provide healthcare and also alleviate the financial burdens that we face every day. And to me, this is why it's so important for all of us. And as tribal people, we're always taught that we take care of each other. And that's one of the founding foundations of being a Arapaho individual, is you take care of each other and all the way from the youngest to the oldest. And that's something I believe Wyoming carries in their values as well too, is caring for each other and helping each other. And so to me, this Medicaid expansion would be something to help care for ourselves and also each other. And it's something I really believe strongly in. And once again, going to the aspect that as the chairman is something I see every single day, and I got to make tough decisions. And I don't want to have to make tough decisions depending on people's healthcare in their lives. That's something I shouldn't have to do. It should be something that's just automatically given to all of us. It's just something that's automatically is considered at the top of the priorities for all of us here in Wyoming. But it's something really hard that I have to do every day. And getting those requests and having to inform people that like, okay, well, we can fund this, we can't fund that. Or we can't help you to your trip there. We're sorry, make it happen. That's really difficult for us. And I think that being able to alleviate this burden with that really help us. I invited Rick Brannon here. Rick Brannon is with Wind River Cares, who I really credit in helping curb the pandemic here. I think it could have been a lot worse, but Wind River Cares was really, strong and really proactive, and they really made tough decisions and really created a model, including wearing the masks and doing that aspect here and practicing social distancing that really helped us. But Wind River Cares was able to do that is because we can do those things independently of IHS, which is historically underfunded. So I'll let Rick speak about
that. Mr. Chairman, it's an honor to be here to speak, and I also thank our chairman here. I've got almost 20 years in the healthcare industry. I was an administrative officer for 6 years, which basically is like a chief finance officer. I've been a CEO for probably 14 years. So I'm going on right about 20 years. I used to be the CEO for the Indian Health Service for the healthcare system throughout the Wind River Reservation. And we are funded at 35% of our actual need, which means that in many instances we had what you would call death squads. Okay. Now, the Indian Health Service has what they call purchase referred care, which is a program that allows you to provide services that you can't do within your clinic walls. The issue was the funding was so low, we had to stick to priority ones, which a priority one is defined as loss of life, limb, or eyesight within 72 hours. There were a lot of orthopedic procedures that we should have done, but we didn't have the money. Therefore, the only other treatment that was available to us was painkillers. And there has been, multitudes of communities that have been impacted by opioid epidemic. And so we are, wrestling with that issue. But the thing that has allowed us to be successful and allowed us to provide health care is Medicaid. Medicaid is our life. It's our blood, our lifeblood. It allows us to increase and enhance the services that we provide to our patients. When we started out in 2016 on January 15th, the IHS basically handed us the keys and said, good luck, but we know you're going to fail. Okay, they appropriated $3.3 million to us, and they sent us a bill of $5.4 million. So from day one, we started out underwater $2.1 million. We've grown through, about 5.5 years. And basically what we've been able to do is turn that $2.1 billion deficit into more than a $45 million business. We did about $45 million last year. And a lot of that has to deal with being able to collect Medicaid. We enroll a majority of our tribal members because we have a very high poverty rate. And without Medicaid, we would be dead in the water. The issue is, many years ago, our ancestors signed treaties with the U.S. government. As part of that, with us giving up our wealth, which the Arapaho tribe and the Cheyenne tribe owned the land from New Mexico all the way through Fort Collins, Denver, stretching up through Cheyenne, Gillette, up to the Black Hills. That was our Aboriginal homeland. We were basically forced to sign a treaty, and within that treaty, it said, as long as the grass grows, the water flows, we will provide these services for you. Healthcare was one of them. But as you're well aware, there's authorizing legislation and there's appropriated legislation. Basically, treaties are authorizing legislation, but we never get the appropriated funding to meet the obligations of the United States government. So the way the United States government meets their trust responsibility, we refer it as trust responsibility because they promised that within the treaties that we signed. The Arapaho people, I think we probably have 6 treaties. So we call that a trust responsibility. And the way we see the United States meeting their trust responsibilities based on the treaties we signed is through Medicaid reimbursements. And that's the only way we can cover our costs is through Medicaid. Within the Billings area, that includes both Montana and Wyoming. Montana does have expanded Medicaid. I mean, it's stark, the comparison between what we're able to provide our patients as opposed to the patients that do have expanded Medicaid in Montana. It's a complete night and day. Our issue here on the reservation, our average age of death was 49 years old. We were able to increase it to 54 years. Okay, the reason being is because our 20 and our 30-year-old children die. Now, I'm an old feller, that's why I call them children, but you know, and it's because of lack of resources for treatment, for helping them with behavioral health issues. So we started the 638 contract, and I was a member of the council at the time, and we advertised the job. There was no takers. I already had the experience. So I offered to the business council that I would step down off to the Rappel Business Council and take this job. It was very scary. The first 3 years, I didn't know if we were going to live or die. Worrying about meeting payroll. It's just like a business. It may be something like a federal entity, but it's a business. I got to meet payroll every 2 weeks. I got to pay for my pharmaceutical costs every month. I've got to build an infrastructure. But what it's allowed us is the Medicaid program has allowed us to save lives. It has allowed us to expand. We currently started evening clinics and weekend clinics at our Riverton clinic, our Riverton location. What that allows us to do is provide needed health care to our tribal members and even Medicaid patients, that they are Medicaid patients. But by virtue of doing that, we are saving the federal government, not the federal government, but the state funding. Because there is we've talked about the FMAP, okay? If an eligible IHS Indian Health Service beneficiary is served within an IHS or a 638 clinic, it's 100% federal pass-through funding. The state does not have to contribute the 50% match. And we did an estimate, and we probably saved the state about $30 million over about a 15-year period. And they give us the 100% match because it's part of meeting their trust responsibilities because of the treaties they signed with us. Currently, we've ordered mobile clinics, dental mobile clinics, primary health clinics, vision clinics. And what we're going to do is take them directly to our school districts, the buildings. And we're going to provide services to our children, or to the young people that can qualify for the services. And that's the major focus of our practice is prevention. If we raise healthy children, they'll grow into healthy adults. And it's very hard to quantify preventive health in terms of how much money you save. But if we're going to do well child checks, we're going to provide the eyeglasses to the children. We have a mobile clinic that's a child advocacy center, basically, where we can interview children on a mobile clinic if they've been sexually physically abused. And it's basically do a forensic interview for the child, but it's also a sexual assault response team or SART vehicle. But you know, we talk about Medicaid expansion. We talk about the impact that Medicaid truly has on people, and I've seen it. I've seen it for the last 25 years, and it's made a world of difference. It has saved lives, it has improved lives, and it's extended lives. And unfortunately, in healthcare, you have to live by the equation: money equals healthcare. You have no money, you have no healthcare. And I'm sure everybody's aware of that equation. If you have private insurance, you still have to do your copay. But if you don't have private insurance, you got to put money on a barrelhead and prepay the doctor. And so, you know, that's why I'm speaking for Medicaid expansion, is because it's people's lives, okay? And I always have to share this story with everybody. When I was a CEO, God came to my office and he stood by me. And he told me, enough is enough. Enough early death, enough trauma, enough suffering. And he took his hand and the devil was there and he pushed him. The devil was as tall as God's hand was wide. And he wrote enough on my heart. God, I mean, true Almighty Father. And he told me, you have to take the sleep of faith. And I knew my job. I was very comfortable as a bureaucrat. I mean, you know, I had the systems built, just tweaked here and there, and you know, but I had to take that leap of faith. So I left and I became a director of health and human services for a short period of time, and then all of a sudden, like a dummy, I run for business council. I'm an old retired politician, also, but it was God's will that I be elected, because we wouldn't have been able to negotiate that contract without him. And then one day I was feeling very depressed, very down, and from my passenger seat, the words were, everything I do is good. God told me that. And so what people come to me, they cross our paths, and there's something we need that falls in our laps. And it's a blessing from God. And I tell the employees that come, you're a blessing from God. And you know, I'm not a preacher. I'm not a pious guy. I don't go to church. But I pray. I believe in God Almighty. I believe in Jesus, the Holy Spirit, Jesus Christ. And he's the one, that's his will. He's doing this. I'm just a vessel, okay? I was into it for about 4 months, and all the money was going out. Nothing was coming in. So I got on my knees and I told God, I quit. I give up. I can't do this. I surrender it to you. And the minute I did that, that's when it took off. And, you know, I'm not Billy Graham. I'm not claiming to, be Jerry Falwell, but I have to share that experience. I have to give the glory and the credit to God Almighty, because he's the one that did it. And I sit here in front of you and tell you that is my personal experience. And he loves everybody. He loves us all the same. But more so, he loves poor people. He loves people that are in pain, because he's a God of restoration. And that's what this Medicaid expansion will help do, is help restore the mothers that we were talking about, the ladies. You know, we as, we're blessed. I'm blessed, but God always looks at others that are less than us, but he always blesses the ones that are the least. And that's why I'm here. I kind of took over. I'm sorry to Chairman Dresser, but I have to give the honor and glory to who it belongs to, which is God in heaven.
Yeah. Well, appreciate your story.
Yeah.
It's great.
Yeah, it's true.
Thank you.
So,
And Chairman, anything to kind of wrap up then? Appreciate you being here today. How old are you? Like the youngest chairman of all time?
Maybe.
Congratulations. Well, I appreciate you.
But it just thank you, Chairman, and thank you all for listening to us today. It's just the power of, I look at Medicaid as just the power of taking care of ourselves and be able to do that. And once again, it's an exciting time for us here, just because we're trying to revitalize a lot of our culture, language, and also ourselves. And and a big thing for me, I'm drug and alcohol free. This big thing I try to stress to all of our tribal members and our younger ones like me and younger ones, is just the power of taking control of your lives. And that's the power of healthcare, is taking control of your life.
yes.
So thank you all.
Well, thank you.
Yeah.
I think I have a quick question here, Representative Yen.
Thank you, Mr. Chairman. Yeah, so I that was actually really enlightening, because I didn't know that Medicaid eligible members of the reservation are 100% matched by the federal government instead of taking any state funds at all. So that's really interesting. If we expanded Medicaid, would those newly covered members also be 100% matched by the federal government as well?
Yes, they would be 100% match, because it's as long as they're IHS beneficiaries that qualify for IHS services, we provide the services. The state doesn't have to match anything. Senator Case, Senator Bebout, Governor Meade, and Lloyd Larson, they've been working with us for 10 years or longer, trying to get Section 1115 waiver, uncompensated care waiver, through CMS. But when President Obama was president, they, I guess, held the state hostage and saying, you have to do the whole state. And then President Trump, had his own way of doing whatever. Now, President Biden is, opening it up more so. And, what we're looking for is, funding so we can properly take care of tribal members. And the issue is the federal government wrote the treaties and they made the promises. And we've given up trillions of dollars of wealth. And the United States has generated trillions of dollars of wealth off our resources that unfortunately we no longer own. But by virtue of the treaties, that's why they pay 100% FMAP for IHS patients. So,
Appreciate that. And then, okay, anything else? Well, I appreciate you joining us today. Appreciate your testimony. Thank you very much.
It's good to see an old friend and a new friend.
Yeah.
yeah,
Thank you very much.
thank you.
Okay, I'm going to ask now, we're going to transition now to public comment, and we're going to first we're going to divide this issue like a bill, really. And we're going to say folks who are against this expansion issue. And I just want to kind of see how many, what I'd like to do is take like 45 minutes. Those opposed, 45 minutes for those are in favor of expansion. And I'd like folks who are online that are opposed to expansion to raise your yellow hand. And then we're going to get the count on you. And then are there folks here in the room who want to speak against expansion? Okay, raise your hand. Got one here. And we're going to start with you. We want to always start with people who are physically present. 1, 2, 3, 4, 5. I see 6. So about, 7 minutes or so each. We're going to go 45 minutes. My good co-chair is going to be the timer. Yeah, because I'm going to be watching and so somebody's got to run the clock.
Total or time each?
No, maybe I can. We got it, man. We got it.
I'd rather be the nice.
Yeah. Okay, so we're going to
Mr.
start
Chairman.
now with folks. If you would come forward and address the chair, and then
Mr.
that'll be
Chairman,
everybody in the room, and then folks online, there's a little bit of a transition, and we'll give you a thumbs up once we adjust the sound, and we'll just roll from top to bottom. I'm not controlling that. I don't even have the list. I think, and we'll just go in that order as they are up there right now. And you've each got about 7 minutes. That'll take you guys to about 45 minutes. Folks who are opposed. Now I see 2 here in this room. So you 2 are together. So there's 8 of you. Okay, so are you both going to speak?
Yeah, yes.
Okay. So we got about 6 minutes each. Be wonderful. Okay, thank you. Welcome. Introduce yourself. Who you represent?
Hi, I'm Nina Weber. I'm from Cody, Wyoming, and I represent many taxpayers.
Okay, yourself. Okay, perfect.
Thank you for having me here today. I oppose Medicaid expansion. On my drive down here, I went through Cody, Meeteetse, Shoshone, and Riverton. The 2 most common words on many businesses today were not Medicaid expansion. The 2 most used words that I saw are, in fact, hiring now. Medicaid expansion will not fill those jobs. It would move us closer to a single-payer medical care than the freedom of choice in a free market economy. Also, the states that have expanded Medicaid have seen an increase in the number of taxpayer-financed abortions. After Alaska expanded Medicaid, the average number of taxpayer-funded abortions increased by 25%. If Wyoming passes Medicaid expansion and the Hyde Amendment is taken away, it will increase the number of abortions being performed and covered by taxpayers. This is unacceptable in a state with the majority of its citizens believing in protecting innocent life. Medicaid was designed for the truly disabled, helpless individuals, but Medicaid expansion is a disincentive for able-bodied adults to seek employment or find better employment and adds a greater burden to taxpayers. Medicaid expansion in other states have caused people to switch from private insurance, thereby increasing the risk pool and further increasing private insurance rates. As more people are added to the government healthcare, the reimbursement rates to doctors and hospitals is decreased. The quality of care is reduced and the wait time for services is increased. Montana has truly needy individuals on its Medicaid waiting list compared to its 2 non-expansion neighbors, us, Wyoming, and South Dakota. After the first full year of expansion, Montana hospitals saw their hospital profit margins plummet by 40%. And the head of the Montana Hospital Association directly attributed this cost shifting due to low Medicaid reimbursement rates. Montana now has fewer hospital beds per capita compared to its 2 non-expansion neighbors, Wyoming and South Dakota. Colorado, New York, and other states have suffered these same problems. 2 years into the program, Montana lawmakers tried to implement a common sense work and community engagement requirements. While it passed the legislature, the feds have dragged their heels, and now the Biden administration is throwing out those work requirements entirely. Once Medicaid expansion has its foot in the door, the solution to the problems that result are not easily, if ever, solved. Please vote no on Medicaid expansion. Thank you.
Thank you, Ms. Weber. Appreciate you traveling down here. How far a drive is that, Cody?
We got a little bit of snow up there in Wapiti, so I got to drive really slow for part of it. But luckily the roads were dry, just under 3 hours today.
Yeah. Well, I appreciate you taking the time and
Yes.
coming here. Were you here this morning too for some of the?
For some, yes,
Yeah,
sir.
you'll see it. You can see it on YouTube too.
Yes, I
some of
can't
that.
wait to
So,
see some of it. I understand that there was a lot of discussion on that Hyde Amendment earlier that you were bringing up.
Was, right.
Yes.
And a lot of, absolutely. Okay, next, go ahead.
So I
I came down here with Nina, and I'm surprised that she, even though she picked me up in Thermopolis, she did not include Thermopolis in her list.
Yeah.
of towns
Go ahead and
she went to.
introduce yourself.
Thermopolis is on
Yeah.
there too. I was like, wait a minute. Just weird. Okay, so my name is Cheryl Aguirre. I'm probably going to come at this from a little bit different perspective. I taught many years at Colorado State University. I'm a social psychologist. I've done a lot of soft money. I've done a lot of grant work for federal, state, county things. And I will say that it seems, I always look at things like, have you thought it all the way through? Because a lot of times things look really good, face value, face validity, whatever you want to call it. But when you really kind of think out the outcomes, short and long-term outcomes, they turn out to not be very well. I worked for the Triethnic Center at Colorado State University for a long time, and I remember we went up to Cheyenne to do some project with pregnant teens, right? And this was back in like whatever, I'm not even going to say, but we went out there and we thought this was a really cool idea, and it ended up really hurting every single one of those girls. And I'm not going to get into what it was in case anybody knows anything about it, but it sounded really good, you know, but it teaches you a lesson that you really need to evaluate and look at the outcomes that you have on a project. I'm going to make an analogy to this, to maybe what you're doing here, what you're thinking of doing with the Medicaid expansion is the Biden administration and AOC and a lot of climate change advocates, okay? So what do? They say, hey, we got to stop this oil and gas, all parts of it. No more drilling, no more pipelines, no more jobs for that. It's going to hurt. It's going to hurt a lot of people in the short term. But in the long term, we're going to have cleaner air, the earth is going to be better. It's going to be really good in the long time. The end will justify the nasty means. And you're thinking, oh man, is she going to say that a lot of people are going to be hurt and that's going to be okay? Kinda. Because then I thought to myself, because I'm a scientist and a researcher, what do studies say? Well, there is a study out of the University of Virginia on Medicaid expansion. Did anybody talk about that at this meeting at all? I don't want to repeat something. Okay. The study at the University of Virginia found that Medicaid surgical patients, or I'm just going to give you one statistic, were 13% more likely to die than non-insured patients. Medicare, patients were 45% more likely to die than those with private insurance. Uninsured were 74% more likely, and Medicaid were 93% more likely. In other words, despite the fact that you're planning on spending millions of dollars on a program that you really don't know what your outcomes are. I don't even know if you've actually written them down. These are our goals, and this is how we're going to measure them. But you should. Despite the fact, Medicare beneficiaries, according to a very well done empirical evidence, science-based study, were on average fared worse than those with no insurance at all. I oppose it, the Medicaid expansion, simply because I don't think you've done enough work on the outcomes of it. Medicaid is part of the welfare state. I'm a conservative, I'm very conservative. That promotes social dysfunction. I grew up as a liberal, okay? A Democrat from Minnesota. I started working at Colorado State University, and I was as liberal as they came. I couldn't understand why everybody didn't get help with everything they did until I started being that do-gooder. And I know that sounds nasty and kind of jaded, but I've learned that some of these do-good programs end up hurting more people and in worse ways than not doing anything at all. So just at least think about it. Thank you.
Okay, thank you. Any questions? Okay, well, thank you for coming from Thermop. That's a little closer.
Yeah,
Thank
and
you.
she forgot all about it,
Yeah,
even though my truck's parked there.
thank you, guys. Appreciate it. Anyone else here in the room opposed to Medicaid expansion? Okay, so we're going to transition to online. Folks online, it'll be just a moment. as we work these mics, and then we'll give you the thumbs up. Okay, so you folks who are speaking against Medicaid expansion now, you've been moved from an attendee to a panelist. So if you could please raise your Zoom hand again, and then that'll kind of order everybody. And then our staff can let you in and unmute you and those kind of things. Okay, so that's all happening here. Okay, everybody who is going to speak against, please raise your Zoom hand. There we go. Okay. And so, okay,
Just go
very
down the
good.
list.
And we'll go work right down the list. Okay. So first is it Miss Ramber? Is that who you? Okay, please admit. Yeah.
Hello. I'm hoping you can hear me okay. Okay. I'm Shelta Ramber. I'm from Sheridan. I'm a no to the Medicaid expansion. Healthcare and healthcare insurance is a giant issue that I wish our elected leaders would solve, not just run on the promise of solving, but actually solve. And that's a conversation for another day. The solution is never more government. I am a one-woman business owner. In my busy times, I hire an assistant. One time, one of these assistants told me she could only make X amount of dollars a week, or she would lose her Medicaid. This woman was working way below her station that she was capable of doing. Like, she could probably run circles around me as a business owner. But she was making meek amount of money, all for free healthcare. This proposed expansion would add more people like her onto the pile. Furthermore, Medicaid expansion has incentivized companies to cut hours of employees so the company does not have to provide major medical to part-time workers. Owners, of course, are looking out for their bottom line, and they're going to put more people in the system, leading to more government and more socialized medicine, and leading to socialism. These systems are failing people they claim to help. The pursuit has been promised to all Americans. The handout was not promised. Where has the value of hard work gone? Wyoming needs its elected officials to lead and inspire the true values of Wyoming, and that is hard work that's rewarded. Please vote no.
Hello, can you hear me? Okay. All right, I can't hear you, so I'll just go ahead and provide my comments. Thank you very much. Mr. Chair, members of the committee, thank you. My name is Mark Gaskill. I was the manager of Wyoming Medicaid Quality Assurance and Program Integrity. My experiences may not be unfamiliar to some present today, but in summary, my team's efforts while I was manager of Medicaid Program Integrity, my team's efforts to identify and correct waste, abuse, and fraud were obstructed by executive management, resulting in millions of dollars of taxpayer funds lost. When concerns were raised, I and my wife were literally run out of town and out of the state. Rather than acknowledging the problem, the executive team and the governor's office and the AG's office circled the wagons. Rather than investigating the demonstrative failures, the executive team released a statement essentially stating, we asked the Fox about the missing chickens, and the Fox said everything was okay. Now, what I mean by that is I had demonstrative evidence about the waste, abuse, and fraud and obstruction and presented it. And I was never interviewed. None of the evidence was evaluated or looked at. And as a result, the state has lost millions of dollars to waste, abuse, and fraud, from the Medicaid coffers. Now, this culture remains within the Wyoming Medicaid leadership to this day. There are inadequate and independent controls and oversight of Medicaid dollars to ensure waste, abuse, and fraud are adequately addressed. The previous witness or speaker presenter before the committee seemed to be very nervous about the answer that the questions that Senator James answered, because the answers were inadequate and the internal controls are inadequate with the present Medicaid system and executive leadership. With expansion, I can't imagine that would improve. Prior to expanding Medicaid, I would implore you to initiate adequate controls. That would include an Office of Inspector General or an independent auditory oversight entity, and that these oversight entities maintain Yellow Book standards and also controls for independent audit and investigation. And as always, I would open my books and notes, my personnel file to the legislators and any investigative review to demonstrate that I know what I'm speaking about, that there is demonstrative evidence supporting the executive ineptitudes in managing waste, abuse, and fraud in the present system. And I think that the present executive team has shown an inability to make the appropriate corrective actions. An earlier witness spoke to not the gentleman, but the criminal who just got out of prison from the Powell area. Unfortunately, the federal investigators had to be called in and to clean up Wyoming's mess. How do I know that? I made that referral to the federal investigators after the Wyoming Medicaid executive team made 3 distinct and demonstrative efforts to obstruct my investigation. I would welcome the opportunity to meet with any legislators later on to really show the ineptitudes of the Wyoming Medicaid efforts to control waste, abuse, and fraud. They just can't do it. And to throw billions more at it is just clearly a mistake until this issue is adequately addressed. And as far as I can see, it has not been adequately addressed. Thank you for your time.
I don't hear anyone in the committee room. I'm wondering
Yeah.
if I might be able to go next.
Me neither.
If either of the chairs could nod.
Right.
I'm not
Go ahead,
not
Hayden.
seeing anyone. Okay.
Go ahead.
Okay. Senator James is giving me the okay to go ahead. I don't know if I'm supposed to though. I see Chair Harshman with his hand up. So
Hey, just let's pause for a minute. We'll go ahead and click on you and ask you to unmute. And we have this little odd thing of 2 microphones. So we have to turn our microphone off when you're talking, these online participants. And so I think next up is Carl Allred, Kathy Ide, Hayden DuBois, Jimmy D. Lees, and Angela Sylvester and Cassie Craven. That's the order that I see on the screen. And so we'll let you in kind of in that order. So next is Carl Allred. Okay, I'm going to turn my mic off so we can transition over.
You dropped off.
Kathy, I think you were next.
Okay. Oh, can you hear me now? Can anyone hear me? You can? Okay. Thank you, Mr. Chairman. My name is Kathy Ide. I'm calling in from Casper. And I'd like to just address my opposition to the Medicaid expansion. It's manifold, my reasons, but my main concern is the expansion of socialism in Wyoming. This bribe that the federal government is offering with its expansion funding is not something that will make Wyoming stronger. It is a bribe that masquerades as a compassionate string to bind us together. But in reality, it's a rope that will choke our state, with socialized medicine becoming more deeply entrenched in Wyoming. There's been a lot of conversation today about negotiating with the feds regarding the terms Wyoming would be agreeable to. But I find this extremely troubling, as socialism in any amount is something Wyoming should never find attractive or agreeable to. Today, our nation is almost unrecognizable compared to its outset as a nation founded on faith, individual freedom, and self-reliance. We have become a nanny state that looks to government to supply our needs rather than looking to God and hard work. We have become dependent upon the federal government as our provider, as clearly evidenced by this committee's consideration of Medicaid expansion. I just urge you to stop the destructive advancement of socialism in our state and to oppose Medicaid expansion. Thank you very much.
Okay, I just got the notification to be unmuted, so can you all hear me? Great. Hayden DuBois, Senior Research Analyst at the Foundation for Government Accountability. Thank you for allowing me to testify today. Just want to start actually on a point Representative Gray had mentioned earlier today about hospital financial shortfall data, and just confirm his point that FGA put together and clarify. FGA, we took the CMS filings of all hospitals in the country and looked at the reductions in uncompensated care costs after expansion was implemented, but compared that to the change in the payer mix, the number of new people who were using Medicaid as opposed to, for example, private insurance. And what we found was that in expansion states, Medicaid shortfalls grew by $5 billion in total because the reduction in uncompensated care costs was more than offset by the poor Medicaid reimbursement rates, which is about 60% of what private insurance pays. Now, putting that aside, I mainly want to focus on one item that was talked about a little bit earlier today, which is whether or not Wyoming can opt out of expansion. As the committee knows, there is a bill, HB 162, which had an amendment attached to it that passed the House that would have reversed Medicaid expansion if the federal 8-quarter incentives expire as they are currently scheduled to do. It's well-intentioned, but it is wishful thinking. Once a state expands Medicaid, it cannot unexpand. And I know someone said earlier today, they're 100% sure they can back out. I'm 110% sure you can't. Under federal law, once implemented, the Medicaid expansion population becomes a mandatory coverage group. The National Federation of Independent Business v. Sebelius decision, which granted the ability of states to opt into expansion, left intact the legal scheme and legal requirements which treat expansion as a mandatory population under Title 42 of the U.S. Federal Code. Any attempt to back out would be met with hostility and likely an expensive lawsuit from the Biden administration. While expansion is permanent, these new incentives are not, as we've already talked about. Indeed, our estimates suggest that if you look at a 10-year window, the incentives, which last for only 2 years, would be offset by the costs by about $200 million, and that's state-only costs, not even counting the federal share. The other half of this coin is that recently enacted federal legislation provides, for the first time ever, free private insurance on the exchange for folks earning between 100 and 150% of the federal poverty level. That includes the critical 100, 138% FPL category that Medicaid expansion would cover. This is silver private level plans on the exchange in the form of premium tax credits that reduce those Wyomingites' liability to zero. Biden is already seeking to make these subsidies permanent. Currently, 4,200 Wyomingites between 100 and 138% of the federal poverty level are on the exchange and qualify for this free private care. Another 8,000 uninsured Wyomingites who have income in that range also qualify for this new federal position. And by choosing private insurance, they'd be reimbursing providers at a higher level than Medicaid. However, since individuals who become eligible for Medicaid in the event of expansion automatically lose their eligibility for premium tax credits, a decision to implement expansion in Wyoming would move these roughly 4,200 on exchange Wyomingites. Bit of an echo there. This leaves Wyoming lawmakers with a simple choice in my mind. Option one is to permit the federal government to pay for the full cost of private insurance for those between 100 and 138 at a higher reimbursement rate. Option two, to expand Medicaid, kick many of these folks off their private insurance, move them onto welfare at lower reimbursement rates, and have the state start picking up the bill for expansion. I think the choice is clear. I know I'm limited in my time. I'd be more than happy to go further into some of the alternatives like Farm Bureau plans, expanding association health plans, reinsurance programs that have been successful in Colorado and Montana, direct healthcare arrangements, other opportunities, but I'll only do that if the committee has questions for me. And that concludes my testimony.
Thank you, Mr. Chairman. Mr. Hayden, can you get us some of those alternative things that are out there that we've not currently seen for the committee? Can you send that to the committee?
Sure, I can certainly send along. My echo again. I can certainly send along a memo outlining several alternatives. I don't know if you heard that, but I can certainly send along a memo with alternative options to the committee. Got it. I don't know if there's any other questions for me. I know Senator James has his hand up, it seems, online.
I know I'd certainly like him to expand so that way the public could hear everything he has to say.
Sure. If y'all can hear me, I'd be happy to expand on that a little bit on those alternatives. So just to go over them very briefly without taking up too much time, the first one that comes to mind would be what's known as Farm Bureau plans. This is something that a number of states have done, including South Dakota, most recently in this session. Tennessee has pioneered this approach. What they do is they take their state Farm Bureau, and it's kind of like a combination of an association health plan and a health sharing ministry, where the Farm Bureau provides health plans that are exempt from traditional Obamacare requirements. And as a result, premiums are between 50 and 70% less expensive on average. Yet they include robust options like no annual or lifetime limits, broad networks, valuable plan benefits, HSA sharing, telehealth, dental, vision care. And they specifically target folks who would otherwise be uninsured because they simply aren't able to afford individual market plans. I would note that it extends beyond Farm Bureau members. In Kansas, they extended this to truckers, dentists, architects, a number of other industries, bankers. So that's been an incredibly successful program. Wyoming could do more on telehealth flexibility or allowing across state line care, allowing additional providers to use telemedicine, I think would be great. It was mentioned earlier, Wyoming's work with direct primary care. You could expand that with greater direct healthcare arrangements by allowing a wider group of providers, to engage in direct healthcare plans. Expanding association health plans by putting in a law framework for self-insured multiple employer welfare arrangements would be a great opportunity for small businesses to offer insurance to their employees. Expanding scope of practice laws like all but one of Wyoming's bordering states, including Montana, Colorado, Idaho, Nebraska, and South Dakota, have done. Creating a prospective reinsurance program. So this was done in Colorado, where premiums went down by about 20.2%. Montana, they went down by 8 to 14% by entering into a waiver with the Center for Medicaid and Medicare Services to engage in a prospective reinsurance program. These are just some of it. I know I'm getting a call to wrap it up, so I can provide more in a memo to the committee to expand on those further.
Yes, my name is Jimmy D. Lees, and I am, okay, I am I on? Can you hear me? Okay, thank you. All right, my name is Jimmy D. Lees. I live in Sheridan, Wyoming, and I also represent the Republican Women of Sheridan County, which is a group of over 100 women. And we adamantly oppose Medicaid expansion. I would like to first give you a personal example of a dire situation many, many years ago that happened to my daughter and son-in-law. They were students at the University of Wyoming. They had a 2-year-old, and my daughter was pregnant. The baby was born very early, 5 weeks early, premature. They had to flight for life the baby to Denver Children's Hospital. And my daughter and son-in-law and their little boy had to stay at the Ronald McDonald House. They were there for around 4 weeks. Then when there was a lot of medical care involved and so forth. They had no insurance. The hospital, the doctors, everyone that was involved, they all got together and they came to a price where no one would lose any money. The doctors, the hospital would not lose any money. They would make whatever money they needed to make to support their business. And they were given a payment system. And when my granddaughter was about 14 years old, my daughter called me and said, "Hey, Mom, just wanted to let you know that your granddaughter's paid for." And they made their payment, whether it was $25 a month or $50 a month, or as they both began to make more money in their lives, I think they began to pay more back. But the thing is that there are other ways than going to the federal government. And sometimes the simplest and most obvious solution we think is the best, but it can be a trick that comes back to bite us. And as we've seen in states around us, just for example, we've talked about Montana. What happens is that we may help 25,000 people to start with, but there are people that are borderline where they might need something like this, that they will not try and advance their careers. They will try and have maybe less money so that they can get free insurance. And there are people that will take advantage. And the problem with the Medicaid is that the doctors and the hospitals do not get what they need. It can be 40% short of what they need. So what they have to do for the hospitals and the doctors to stay in business, they have to increase what they charge to private insurers. Well, then the private insurers, they have to increase what they ask for the cost of private insurance. And it all becomes just this negative self-feeding cycle. And there are other solutions out there. And I really appreciate that with the young man, all the possibilities he gave before we talked to him. I believe it's a trap that the government, if they can get enough states to go into this, and what's going to happen is the price of private insurance is going to get so high that they'll come up with a wonderful solution and go back to this Medicare for all bit. Well, my husband and I are on Medicare, and what's happened that the price increases every year. Then now we have to have supplemental insurance. Now we have to have separate insurance for medication. And altogether, we pay just a little bit under $700 a month for what people think Medicare for all is the answer. But we pay as much as we would if we were paying for private insurance. However, we're forced to be on Medicare because of our age, even though we were always on private insurance. And so this idea of free insurance, it's just a pit to fall into and give the government more control, and we would regret it. So I appreciate you hearing from me, and I appreciate you taking the time to consider all these things. Thank you.
Okay, thank you. Am I up now? Mr. Chairman, my name's Carl Allred. I'm from, let's see, is it? You have me? Okay. My name's Carl Allred. I'm from Uena County, Evanston. I know, well, you guys all know me, but I'm speaking on and against this Medicaid expansion. I mean, let's be honest, guys, it's socialized medicine. That's simple. And the other fact is that we just can't afford it. But when we try to bring and give free medical care to an expanded amount of people, I'm glad they brought up the Montana stuff, but all the other states are doing that. Indiana, it almost bankrupted their state. And as a gentleman from FGA, he said that you can't get out. We can talk about if the federal government backs off from 90%, that we can get out. We can't. Once you give candy to these people, you can't take it away. And the quality of healthcare will go down. You know, I've been to lots of countries that have socialized medicine. And you even take our neighbors, Canada here. The people who can afford to have procedures done, they'll come to the United States and they'll pay for it, even though they've already paid for it through their taxes up there in Canada, because they can't sit on a waiting list. I mean, you want a hip replacement, you might be 3 years out. So people come to the United States. When you look at some of the quality of healthcare, I mean, you take a look at, for example, I don't know if any of you guys are landlords. I've been before, and if you've ever owned Section 8 housing, it's great because you don't have to chase the rent. It comes in from the government. That rent check comes in. Well, I don't think any of you guys want to live in Section 8 housing, because as long as the government's paying for it, we don't care about keeping, top quality property. There's a lot of options we can go to rather than going to Medicaid. When people, y'all pay car insurance. Well, what do you think that auto insurance would cost you if it paid for all your oil changes and your tire changes and well, heck, even your fill-ups of gas? You wouldn't be able to afford it. And that's what we're trying to do with health insurance. Years ago, when I first got started out, I had a catastrophic health policy. It didn't pay for doctor's visits. It didn't pay for basic medication, prescriptions. But if I had a life-changing catastrophic event that put me in a hospital, that's when that insurance was there. And that's what insurance is supposed to be for. You take a look now, the health department showed the Oregon study there. All of the visits and the medical doctors' things went way up once they expanded Medicaid. Well, because it's free and it doesn't cost you anything. You used to be able to get a lot of care from my doctors. Nowadays, when I do get sick and I call and I want an appointment, they say we can see you in 3 weeks. Well, that doesn't do me any good. I need it now. But it's because there's so much free, and there's people going to doctors for a lot of things that they wouldn't go for if they were paying for it. So rather than doing Medicaid expansion, we can look at some of these other options. And I do think it's quite ironic that this bill is in Revenue Committee. I don't know in what kind of world people think that Medicaid expansion is revenue. It is an expenditure. If you expand it, it's going to cost the state money. Yeah, even if the feds pay for 90%, which they're not going to always do because they can't afford it either. But it's costing the state that 10% right now. And every state that we look at that has done this, what they have is projected amount of people jumping on the Medicaid expansion. Those projections are wrong in every single state. They talk about a much lower number here, but I've heard people that have looked at that and compared to other states, and we're talking more 45, 50,000 people on it. So it's going to cost us a lot more money than people are saying. And this is an expenditure. As Representative War said, you take a look at Utah, and now they're more concerned with Medicaid expansion cost than they are with education, which has always been the biggest single thing in Utah. As you know, they got a lot of kids down there. But this is something that could possibly bankrupt our state if we do it. We need to look more at getting the government out of medical and look at doing things that provide a little more transparency in billing. For example, our hospital there in Evanston, it's said all over town, you don't go to our hospital unless you're going to die. You go to Park City, you go to Ogden, you go to Salt Lake. Park City, it's a beautiful hospital, and it costs about half of what Evanston cost us. Thanks. It says I'm out of time, so thank you for your consideration. And if anybody has any questions.
Members of the committee, can you hear me okay? My name is Cassie Craven. I'm here on behalf of the Wyoming Liberty Group today. I want to hit quite a few points, so I'll get going. The first one is, the question is, do we want to stand with states like South Dakota and Texas on this issue, or do we want to stand with states like Washington and California? The coverage gap was discussed this morning by the Department of Health, and I think the answer is clear there. The solution to fixing a broken federal system is not by signing up for more of the exact same broken federal system. They also admitted that the biggest unknown is enrollment, and that's what we've seen in other states. That's a direct quote from the Department of Health this morning. Thus, that $34 million that we've been promised as the revenue, which brings us to the lovely Revenue Committee this morning, means that that's not certain at all. And let's start with what happened in Montana and the misinformation that you've been told with regard to that state. Fact, after the first full year of expansion, Montana hospitals saw their hospital profit margins plummet by 40%. The head of the Montana Hospital Association directly attributed this to the cost shifting of low Medicaid reimbursement rates. The source for that, if you'd like to look it up, the Great Falls Tribune, Becker's Hospital Review. Fact, after expansion, an independent study found that Montana had 12 at-risk rural hospitals. 100% of those were deemed essential to their communities, causing Montana to lead the nation in that grim statistic. Source, the Navigant study. Fact, Montana lawmakers were promised enrollment would cap at 59,000. It is now 96,800. That's a 64% overage. Source, KHN, CBPP, Montana State Medicaid Expansion Dashboard. Fact, Montana Medicaid spending increased by 65% between 2015 and 2018, raising it from 1.1 billion with a B to 1.8 billion. Sources, NASBO report year 2016, NASBO report year 2019. Fact, Medicaid share of Montana's total expenditures rose from 17.4% in 2015 to 26.4% in 2018. Sources again, NASBO report years 2016 and 2019. Also a fact, Montana has more truly needy individuals, the people that Medicaid is designed to protect, on a waiting list, compared per capita to its non-expansion neighbors, Wyoming and South Dakota. Sources, KFF. So what about the administrative costs? Let's talk about that. Fraud and improper enrollment. You'll need people to monitor this. So how does the state intend on planning to fund this growing government scheme where we need new auditors? Because it's a problem. CMS just released brand new data on this for 2020 and said, quote, national Medicaid improper payment rate is 21.36%. That's the amount of percentage points of fraudulent transfers. That equals 86.49 billion with a B dollars of improper payments. It's also interesting that the Obama administration canceled these same eligibility audits from the years 2014 to 2017, which were the first years of expansion. This maximized enrollment, which from the beginning has been the entire goal of Obamacare. It's never been about care at all. It's a socially designed system, which means you need high enrollment. It means you need the people that make the most money to pay for the people who make the least money. This steals our choice, our dignity, our common sense. We are not designed to be the bottom line for hospitals and for government. And that's what this is about. If you want to be on a wait list, if you want to not be able to choose your doctor, have the government decide if, when, and what kind of treatment that you receive, then this is the remedy for you. This is the policy solution for you. But as a woman, it's not the policy decision that I want. Our health care is our own. We are not the bottom line for them. This is not the proper role of government at all, unless you believe someone like Hillary Clinton, who thinks that health care is a right for everybody. And if that line of thinking is not the exact premise behind single payer health care, I'm not sure what is. And I'd like to pivot for a moment and talk about abortion and transgender hormone treatment therapy. This is an issue that it doesn't matter what side of the line you fall on those things. It's coming. Senator Case asked earlier, can you actually imagine the feds saying that you must provide abortions? I can't. Well, I sure can, and the reason is this. On March 25th of this year, an act was introduced in our Congress. It's called the EACH Act, Equal Access to Abortion Coverage and Health Insurance. It has 127 co-sponsors in the US House and 22 in the Senate. Pelosi and Schumer have declared it a priority. Kamala Harris has declared it a priority. It's coming and it will pass. This legislation would reverse the Hyde Amendment. It would guarantee abortion coverage in federal health insurance programs, but most importantly, it would prohibit interference from states or private health insurance companies to offer coverage for abortion care. It completely ties our hands. And in its statement, Planned Parenthood said, quote, the LGBTQ community is still requiring access to healthcare, sexual and reproductive care, and other basic human rights that remain out of reach. The organizations pushing the Biden-Harris administration and Democrats in Congress to assure that taxpayer Medicaid funds are now able to be used for abortion and transgender hormone treatment in their clinics. This comes from their statements. I'm not making this up. You can look it up online for yourself. Planned Parenthood specifically lists these as accomplishments of the first 100 days of the Biden-Harris administration. Number one, move to reverse the Trump administration's Protect Life rule that created a clear boundary between abortion and family planning. They want to get rid of that. Number two, passage of ARP, which Planned Parenthood officials have said, quote, does incentivize states to expand Medicaid coverage by allowing increased federal funds. ARP did not include the Hyde Amendment or the Helms Amendment, which have traditionally prohibited these taxpayer monies from being utilized in that way. However, the FDA has already announced it will be lifting restrictions on the health and safety standards applied to abortion-inducing drugs, which are different from the abortion mechanisms we've discussed here today. That's already happening. Allowing for their disposition over telemedicine through the mail and the establishment of a gender policy council. So all of that is coming, and Medicaid expansion is a very clear carve out and role in that plan. Planned Parenthood said it's going to push in the days to come to get rid of the Hyde and Helms amendments, funding for sexual and reproductive health care programs at home and abroad. And as I mentioned in my testimony when this thing died for the 7th time in history, there's a serious due process implication. And I'd love to know how that plays out when a young child is in the middle of his transgender treatment. Are we just going to yank coverage away? And if you'd like to refer to that act, I'd encourage you to look at section 2.2 of the EACH Act, which was introduced on March 25th, which says, quote, a person's income level, wealth, or type of insurance should not prevent them from having access to a full range of pregnancy-related health care, including abortion services.
And we kind of have this odd microphone issue and it's hard to communicate, but we appreciate your testimony today. And so is there anyone left now to speak against that? So we can finish our public comment on those against, or okay, we're now going to move. How many folks, is it just one online that wants to speak in favor? I'm just trying to get my numbers. If we could have those folks who are online raise their, yeah, we were on panelists. Now we're back to attendees. So I count 1, 2, 3, 4, 5, 6, 7. And then how many folks here in the room would like to speak? 1, 2, 3, 4, 5, 6, 7. You already spoke, didn't you? Did you speak or I can't? Okay, so there's 6 and then 7, 13, 45 minutes. Yeah, 3, 4 minutes each, 4 minutes each. So that's good. We're wrapped in about 40. So who would like, we're going to start in the room. So who'd like to go first? Just, you guys can just queue up. There's 2 seats, so we just keep rolling fast. The next one on deck and keep going. And we really appreciate you spending the time, and coming up and traveling here to Riverton to be with us. Okay.
Thank you, Mr. Chairman. My name is Mike Lehman, representing the Catholic Diocese of Cheyenne. I appreciated some of the attention that was brought regarding abortion coverage, and so I kind of want to focus a little bit on that with our pro-life perspective. We're pretty unflinchingly pro-life in our defense of the unborn, because the science is conclusive. Human life begins at the moment of conception. We wonder if being alive and being human aren't the only 2 criteria for full legal protection in American law. What else is necessary? The American public deserve an answer. In the case of abortion, if we're honest, we will admit that a 3rd criteria has been necessary, that a living human being must also be wanted. And that is a terrifying precedent in our book. And that is why we are unflinchingly pro-life. We also recognize, however, the difficulty of awakening the American conscience toward other vulnerable populations like the working poor. if we're turning a blind eye towards the deliberate intentional destruction of the helpless unborn. So we share those concerns. We are also concerned about the Hyde Amendment under the current administration, which prohibits those taxpayer dollars from providing for elective abortions. That's why the U.S. Conference of Catholic Bishops are appealing to Catholics, other Christians, and all people of goodwill to sign a petition urging Congress to keep Hyde in place. It's not perfect, but at least it does allow for those limitations in Medicaid. It's true that now in America, there's not a consensus on what we constitute as true health care. Our vision of medicine includes the restoration of both the natural form and function of the human body and adherence to the Hippocratic Oath. Others disagree. This is an important ongoing debate, one that we encourage. But we don't believe that it would be prudent to suspend all access to all health care until the debate has been decided. To do that would mean intentionally forfeiting savable lives, even with good intention. Neither do we believe that denying healthcare access to the working poor until a consensus is reached would be consistent with our pro-life perspective. Healthcare is not welfare. I was born and raised in Wyoming. I've never known a Wyomingite who dreams about spending more time in the doctor's office. We tend to avoid these places. We avoid them until we can't avoid them anymore. And then when we can't avoid doctor's office anymore, we remember how humane it is to be able to receive treatment for treatable illnesses and diseases. I appreciate also the mention that many make the government should not be in healthcare. That has caused me pause in the past. But then I realized the state is involved in healthcare and has been for a very long time. The VA is government healthcare. I'm a veteran. And so that makes me wonder, is this really a principle that people are willing to stand upon and say, would we ever say to our veterans, until we have a private option, we say you go without access? I can't imagine doing that. And yet that's what we're doing to this certain part of our population. The church will never cease seeking full legal protection for the unborn from conception to natural death. But we will refrain from leveraging one vulnerable population against another. What we do is important. How we do it is also important. With that, Mr. Chairman, I would stand for any questions.
Okay, very appreciate your service. Army veteran?
Yes, sir. Thank you.
Very good. What high school did you graduate from?
Douglas High School.
I knew that, Bearcat. Okay. I used to see your dad occasionally, and he's no longer with us. Lord rest his soul. Okay, any questions for the good deacon? Appreciate you traveling here, and any questions? Go ahead.
Thank you, Mr. Chairman, Mr. Lehman. So in coming up with that conclusion for the diocese, is there a place there? I mean, say we approve this 6 months later, are you going to come back and say the Hyde Amendment goes away? Are you going to weigh those and say, boy, we wish we hadn't have, and now we'd like you to do all that you can to get out to save some babies?
Mr. Chairman. Thank you, Representative. Whatever happens, we are advocating for the unborn. Like I said, full legal protection of the unborn. The Hyde Amendment is not perfect in our book. So that's ongoing. God forbid that the Hyde Amendment does get repealed, but we do have a petition right now already asking people to sign that, because we recognize it's not a religious question. Many people, non-religious, even pro-choice folks, recognize freedom of conscience and not being forced to fund that. So that will go on regardless of expansion. And I think it's important to note that Medicaid recipients are currently under those limitations. Expansion is not going to change that. It will allow more people to have access to health care.
Okay. Any other questions? Anyone? Okay, appreciate your service. Appreciate you traveling up here, being with us. Thank you very much. Okay, next. Go ahead.
Mr. Chairman, Eric Boley, President of the Wyoming Hospital Association. Mr. Chairman, Josh Hannis, also with the Wyoming Hospital Association.
So, Mr. Chairman, there's a lot to unwrap here, but just so you know, in 2 days, we're appearing before the Joint Labor Committee. We're doing a healthcare 101. And so a lot of the ground that's been covered today will also be covered with that new committee. So it's a good warm up for us. And I actually would like to defer to you. There are a lot of questions, I think, that have come about today, both from earlier testimony and then from the online. I can address the Montana experience. I can address the Utah experience. I actually provided all of you a copy of a letter from the president of the Montana Hospital Association. He lays out everything for you as far as the experience in Montana, and it's been overall positive. It's been an economic boom for them. It's helped stimulate the economy. It's brought additional funding into their state. Their hospitals are all better off than they were before. None of their hospitals are in jeopardy of closing right now. They have services that are actually being offered now, so they're generating new jobs in their communities. And that's one of the things I think is really important to consider here. A lot of our hospitals are struggling right now, and they're trying to determine what services should be provided in their communities. And in our small communities, the hospital provides everything, usually at a loss. With an influx of cash, and with uncompensated care going away, they will have the ability to continue to sustain programs and services in their communities that they're losing money. And that's a really difficult conversation for them to have in those small communities. What should we keep and what shouldn't we keep? And so the Montana experience is great. You also find a study in there from Navigant, which is now called Guidehouse. It's a consulting firm out of Minneapolis. A lot of the Republican governors associations use them. It's not a left-leaning group like Manat and some of the others out of the East Coast. And we actually use them in our state now to do a lot of our different modeling for some of our UPL programs. And so I think there's a really good read in there for you also. There's also Montana Healthcare Foundation, which is independent and separate from the Hospital Association. And you'll find information in them in there also for their support and what it's done for Montana. As we look south of us in Colorado, every single hospital in that state is in the black. They have not lost a hospital. And actually, some of their hospitals are doing so well. They were one of the first states to expand Medicaid that they're actually being looked at because they're doing too well. I don't think that's ever going to be a problem for us, but that is happening down there. When I heard of Utah, I reached out to my counterpart there. And I can share quickly with you what I received back from them. They basically say from the UHA perspective, they said it's been a boon on all counts. Hospitals didn't have to pay for it by assessments because it was voted in by the citizens. The extra coverage for homeless has allowed us to stabilize lots more people with mental health dollars, which is a huge issue for our state. Mental and behavioral health is underfunded, and we're actually seeing problems now in our state because of that. And I know we're working on House Bill 83, 63, has to do with, or is that the right one, Chairman?
Yeah.
Yeah. Anyway, there's a subcommittee on that. They have essentially universal coverage for those folks that are uninsured. The ACOs are doing a super job. Overall Medicaid dollars increase to the ACO population. ACO is an accountable care organization, so it's basically a shared savings. So if they can prove that they're providing quality and lower cost, they actually get to share some of that with the federal government. It's been about a 2% increase for them per year. So Montana, Utah, Colorado, all positive stories.
I think my question really, you know, we got a ton of emails that was talking about Montana, and you heard it here in testimony about wait lists, you know, and that waiting period. But, and I have a pretty good contact in Montana that I asked, you know, he's a lifelong Montana guy. He's been right in the middle of this. His account was different too. He said it's been really good for our small, rural, critical access hospitals. Some of my emails were saying kind of opposite. So what's the story? I mean, because that's what we have in this state, except for a couple. I mean, they're small, rural, critical access.
Mr. Chairman, it's a great question. And overall, the hospitals are doing well. I think we've identified where the wait list is.
Go ahead.
Mr. Chairman, so I looked up that citation a previous speaker brought up, and so that wait list exists in their 1915 waiver, which is their home and community-based waiver services program. And so that's services for people who would otherwise be institutionalized. So nursing home care, things like that. So that's a separate part of the Medicaid.
It's not
program,
this
separate.
expansion population.
It's not hospital or clinic.
We have those waiting lists as well. I mean,
That's correct, Mr.
we
Chairman.
can, we talk about that in every budget session. I mean, okay, that provides a little, any questions, Representative Gray?
Thank you, Mr. Chairman, Mr. Boley. So I'm going to ask a question I asked earlier, and I really want like a specific answer. I've asked this many times, and I've gotten presentations from the hospital associations there. The start of it is slide after slide saying that Medicaid reimbursement is not adequate and is a huge part of the problem, the cash problem, or the net income problem. I think it's important to the net income problem in hospitals in Wyoming. And then literally within 10 minutes, the presentation diverts to a request for Medicaid expansion. And that just does not make sense to me, other than the fact of what you said earlier, which is that, yeah, there's an influx of cash, but if it's not fully meeting the costs of the care provided, yeah, there's some cash, but it's not a venture that my question is, how can those two things go together? That's my only question. Is it volume that somehow is going to reduce the marginal cost of the care provided, and therefore you're going to be in an okay position from your point of view? I mean, I'm not understanding that. Okay.
Mr. Chairman.
Go ahead.
Representative, great question. I'm ready. So I sat across the table from you at the last one, I can remember. And so Medicaid is not the best payer by any sense of the meaning, but it's a payer. And so hospitals in our state deliver between $100 and $120 million of uncompensated care. That's our cost, not what we charge. It's our cost annually. By expanding Medicaid, and if you're a business owner, would you rather get paid something or nothing? And that's basically where we're at. We have uncompensated care that'll be reduced by 30% is what our estimates show based on experience around the country. So that's $30 million of uncompensated care that'll be covered by expansions to these uninsured. And so we're actually going to get paid something as opposed to nothing. Volume is also an important part of that. We have huge fixed costs, overhead that we have to cover with equipment, staffing, and all those things. So yeah, volume is going to drive that as well.
Okay. Okay, very good. Any other questions? Okay, anything, Mr. Chairman, case.
Thank you. I appreciate the clearing up the situation in Montana and Utah, that several opponents mentioned Montana and a couple mentioned Utah. Indiana was also mentioned. Do you have any thoughts about Indiana? And if you don't, that's fine. I tried to look up online. It doesn't seem to be the account of disaster that has been suggested. So what do you think?
So, Mr. Chairman and co-chairman, it's a good question. Indiana is an interesting example. They were one of the first adopters. They also rolled out, I believe they put a work requirement in place that has been controversial at best. They went early. I think one of the nice things with what Wyoming is trying to do is we have historical data of 9 years now. And so they had more enrollees than they thought they were going to do, but their program is very structurally different than what we're attempting to do, especially with the FMAP increase and some of the other things. I think Josh is pretty familiar with Indiana. You have any other?
I don't have any additional thoughts on excuse me, Mr. Chairman, Senator Case, not on Indiana specifically. I do know that in general, the financial strength of their hospitals is much stronger than we experience here. Beyond that, sir, I couldn't say much.
I appreciate the attempt. It just seems like this issue is kind of diffused with respect to Montana and Utah anyway. So thank you. We'll leave Indiana out there for a while, but I do understand it's very different.
Mr.
Thank
Chairman,
you.
we're happy to do some research too, if you'd like.
A question. Representative Yen.
Thank you, Mr. Chairman. So thank you for bringing up the Montana letter that you got. I did notice that all of the opponents were speaking only for the first full year of Medicaid expansion and not for its 2021, which is, I think, 5 years since they expanded. And I did notice that Montana also got a report from their Montana Hospital Association that talked about the 2016 to 2017 year where it increased, their profitability increased by 93% for all facilities. So I was wondering if you'd be able to help us to reach out with your Montana colleagues to get us updated numbers from the course of 2021 to the committee when appropriate.
Mr. Chairman, Representative Ian, happy to do that. Actually, the president of the Montana Hospital Association said he'd be happy to come down and testify and share any information. He's willing to do op-eds for the newspapers. It's been an important program for them in their state.
And that would be great, Mr. Chairman.
Okay, any other questions? Okay,
Mr. Chairman, just
Yeah,
a couple other things
sure.
that I wanted to touch on also. So, we've had a little bit of opposition within our ranks. We've had a couple of hospitals that haven't felt really comfortable with expansion. However, one of the really important programs the hospitals now utilize is called a 340B program, which is actually a pharmaceutical program where hospitals, pharmacies, and the patients all work together, and it allows patients to get pharmaceuticals at a lower cost. And there's actually rebates that go back to the hospitals and to the providers, to the pharmacies. For hospitals to be able to participate in that, they have to have a DISH percentage, which DISH is disproportionate share of Medicaid of 8%. And we have some hospitals that are teetering on that can't participate in the 340B program. But if they did have Medicaid expansion, it would put them over that 8%. And for some of them, it's worth more than $1 million a year. That money is immediately reinvested into services and into providing care in those communities. And so there are other benefits that we can see from expansion of Medicaid that are kind of on the fringe, but they're also really important too. We have, I think, 7 or 8 of our hospitals that actually have a disproportionate share rating where they treat 10% or more of Medicaid, but most of our hospitals are below that. And so it would also be beneficial to those hospitals to allow them to participate in 340B.
Okay, we're going to wrap this up. Question, Representative Henderson?
Thank you, Mr. Chairman. Real quick question. We heard, I think, some comments about healthcare professionals who were in opposition. Have you heard anything about that?
Mr. Chairman, Representative Henderson, that's another great important point that I wanted to touch on. So one of the problems is actually access to care, and we're having a hard time recruiting providers into our state. I actually am aware of folks that have left and gone to expansion states. Some of our WWAMI students that finished up or didn't even have to finish up here because they could go to another WWAMI state and take care of patients with Medicaid expansion. But when we talk about waiting lines and things like that, I don't really think it's one of the issues that we're facing. I think what we're facing is a shortage of healthcare professionals. And I know that healthcare professionals are actually looking at whether or not the state has expansion in place. And I think we actually might be able to entice more, especially primary care physicians, into our communities to help serve our population.
Thank you, Mr. Chairman, Mr. Boley. So 2 things. One, just what you had to say there. How does that work if Medicaid expansion brings up a 30% of a losing game or a loss that you're increasing by 30%? How does that bring in more primary? How does that bring in any doctors? I guess I'm not understanding how that brings those in. And then the other thing is I think we heard from Ms. Cravens, about 5 or 6 minutes when there was one thing, and it was the waiting list, which I'm glad you addressed. But there were several other parts to that with those 3 states mentioned. Do you have any other answers to some of those other statements?
Mr. Chairman, Representative Jennings, I don't remember everything she said, to be honest with you. I kind of toned out after a while. But as far as the primary care physicians, they're either going to get paid or they're not going to get paid. And so we have physicians in our state now that are seeing Medicaid, seeing uninsured patients. So Medicaid, again, would you rather get paid something or nothing? And that's one of the questions. And that's why they're leaving, is because we're not taking care of those. The other thing is they can help make people healthier. They can get preventative care. They can help with chronic disease management, which they cannot do now. we see these patients seeking care in the most expensive setting. They go to the emergency room, which is the most expensive place for them to receive that care, as opposed to going to their primary care physician who can actually help manage their chronic illnesses and do preventative care to keep them healthier longer. We have an aging population in our state. We're going to soon be the second oldest demographically, I think, in the country. If we can help some of these folks, and we're talking about single moms that have 1.8 children, I think was what we looked at, an average of 1.8 children. If we can help keep them healthy longer, keep them in their homes longer, we're actually going to help with the problem that we're going to be facing here shortly, which is where are we going to put all of our sick older people? And it's important that we can help keep them home. There are all kinds of benefits to this that I can see.
Hey, I think Senator James has a question for you, and then we will wrap this up, bring two more folks up, and we're going to keep this moving because we appreciate there's a lot of interest by committee members, but it is getting late in the day and folks are going to be traveling home. Okay, Representative James, you're up.
Thank you, Mr. Chairman. Mr. Bully, so I just have a question regarding if you happen to know what the federal code is on being able to opt out of the Medicaid expansion, and I'll go ahead and wait, and that'll be it on that one. Thank you.
Mr. Chairman and Senator James, I don't know. I'm not that familiar with the statutes. I think we've asked it several times today, and I think we can find it if we need to.
Okay, very good. Okay, well, thank you, gentlemen. Appreciate you traveling here to Riverton to be with us. Safe travels home. Okay, next two, we'd love to have you come up and kind of stage, and that'd be great. Go ahead and introduce yourself and where you're from, who you represent.
These are old friends. It's kind of a nice coincidence.
Go ahead.
Your mic's not on, Roger. You can't see it. You have to look on the side. There you go. You're good.
Good. All right. I want to thank you, Mr. Chairman, Mr. Co-Chairman, and members of the committee for the opportunity to come and speak in support of this most important initiative, Medicaid expansion. My name is Roger Gose. I am a retired physician, having practiced internal medicine in Riverton and Greater Fremont County for 35 years, from December 1977 to July of 2012. I am and have been a strong supporter of Medicaid expansion in this state. Every healthcare organization, to my knowledge, in the state supports this initiative. I was very encouraged with the successful passage of House Bill 162, only to see that initiative ultimately be cast aside. Like many counties in Wyoming, Fremont County is a working class community. I have personally witnessed the impact on people's lives, and I'm speaking about those making less than 138% of the federal poverty level, who have no health insurance. These are not deadbeats. They truly need a hand up to access quality health care. They do not access it because they cannot afford it. No citizen in this state or this country, in my opinion, should face the dilemma of paying the rent or buying food or seeing the doctor. Very often when those options are available, the doctor is not in the picture. Like many counties in Wyoming, excuse me, as a result, these people that I've described, they go from crisis to crisis, basically emergency room visits, resulting in poor outcomes, higher mortality, and at a much greater cost to the entire healthcare system. Prevention is always cheaper than treatment. I am no expert in finance. You people are. I am part of the boots on the ground brigade, and that is the healthcare professionals who actually see and take care of these 20 to 25,000 people. The loss of rural hospitals nationwide, about 150 at this counting, is much higher in those states who have not expanded Medicaid. To argue against Medicaid expansion on the basis of the federal government not maintaining its part of the bargain, to my understanding, is no plan at all. In fact, I believe the data show that the federal infusion of capital has been a financial boon to those states who have expanded Medicaid. In conclusion, I would simply say that in expanding Medicaid, you are supporting a rural healthcare system in dire need of support. And at the same time, you're providing a healthcare safety network to those with the greatest need. Thank you for your attention.
Thank you for your service, people of Fremont County. Any questions for the good doctor? Okay, again, appreciate you joining us today. Thank you.
Tell Barbara hello.
Okay, welcome. And then someone else, whoever's next, can come sit.
Mr. Chairman, members of the committee, my name is John Forelli. I'm the CEO of Sage West Healthcare, serving the residents of Fremont County. I had prepared remarks, but I think a better place for me to go is to build on something that Mr. Boley started with in talking about total uncompensated care in the state. Roughly $125 million in cost. I can't speak to every hospital, but I know that at Sage West, about 6% of every dollar in cost that we provided last year was provided free. I don't know exactly what Medicaid expansion would do in terms of additional revenue, but if it comes down to, sorry? Oh, okay.
Not COVID.
Okay. Better put this back. So any dollar in revenue to help offset those costs would be beneficial to the organization. Most importantly, because it can be put into employee wages, it can be put into equipment, it could be put into funding services that maybe operate at a loss, or in some cases, it can be used to provide new services that a community hasn't provided before. So from our perspective, Medicaid Advantage will inevitably lead to better care for people. It will provide psychiatric care for people that don't have insurance. It will provide care to residents in jails that don't have insurance, and that will lower the burden of costs for counties. So I think any way you look at it, it will be beneficial. I did have the opportunity to work in a state that had a Medicaid expansion program. I mentioned our total costs of uncompensated care at 6%. In this particular hospital, our total costs were 0.5%. So roughly a 90% reduction in uncompensated care in a state that had Medicaid expansion. So thank you. I'm happy to answer any questions.
Okay, thank you. Any questions for Mr. Ferrella? Well, we appreciate you joining us today and your perspective here in Sage West. Thank you. Okay, good afternoon.
Good afternoon, Mr. Chairman. My name is Sheila Bush. I'm here for on behalf of the Wyoming Medical Society. Similar to Eric, I have a myriad of things that I could offer, and I suppose I would offer first before I go into some comments and just sort of address some of the things that have been said. Just open it up. We represent physicians and PAs across the state. So if there are specific questions about the physician perspective, that I can try and do my best to answer those. And if I don't have the answers, I can get those for you. I wanted to start and just give you a little bit of history in some of the work I've done with other groups around the state, including the governor's task force. A commission report from 1994 was surfaced.
Was that 1994?
1994. I think I was in junior high, sir. And so the governor then, Governor Sullivan, had commissioned a health reform commission similar to the one that was then later convened under Governor Friedenthal, but the one in 1994 was chaired by former Senator and Ambassador Tom Strook, a true statesman in our history who's now passed. And so in that report, their number one recommendation, after convening 23 members of the public and stakeholders across the state, including representatives from the University of Wyoming, the legislature, the Department of Health, their number one recommendation was to move the state toward universal coverage of healthcare. And so I just wanted to offer a little bit of that, the number one recommendation, incremental approach to universal coverage, that Wyoming Health Reform Commission recommend that the Wyoming adopt the following goal: universal health coverage by the year 2002. And so the report is a 40+ page report that goes into the details of why this is so important. And some of what you have heard in opposition is that we can't trust the numbers, a lot of skepticism around how many people is this really going to be. I think of interest in this report, they estimated that population would be 19,000 people. And so almost 30 years later, the estimation is now 24,000 people. Our census data in 1990, Wyoming had a population of 453,000 people, a little over, and our estimated 2020 census data is 578,000 people. So I think that that gives a lot of stability and can give us a lot of faith in those numbers that are being presented. They're not new numbers. And this isn't the first time that Wyoming has decided this is the best way forward for us. If any of you have heard from a physician or two who oppose expansion, oftentimes that will be based on this question of if they're a cash paying patient right now. I think there's a small fraction of that uninsured population that could be moved to Medicaid expansion who cash pay now. And there are a handful of physicians in the state who would like to keep them being cash paying. But other than those handful of physicians, all of those who are members of the medical society and our board has consistently, since this issue was raised, voted to support expansion. Of the 1,000 physicians we represent, we don't have unanimous consent on anything, but we do hold this as a very firm position in support. We think it's the best way forward for the state. I think I said before, there aren't any silver bullets, but we keep looking in a tool bag and we see tools, and this one continues to look like the best one. And we're going to keep working on this problem, and we'll keep tackling it from every direction that we can. But Medicaid expansion continues to surface as one of the best options, and that's why we continue to support it. A couple of other just comments quickly, and Eric touched on a lot of this. You heard a little bit about if we expand this population, what will it do to provider participation right now? I think it's important that you know 99% of Wyoming physicians participate in Medicaid. 93% of Wyoming dentists are participants in Medicaid. We do think that this will help with physician recruitment. In addition to what Mr. Boley told you, we also believe that it brings predictability to the environment. And so a hospital that can have a more predictable equation in assessing their bottom line, then maybe has some more opportunity to recruit those physicians and providers. I also think you've heard a lot about if you expand Medicaid, you've got an increased patient population, and who's going to take care of those if we already have provider shortage. I would offer to you that these aren't new patients. We're not busing people in. We're not creating new people. These people live and work with us here today. It's just that we don't have a way for them to access care in the best way, at the best time, in the most affordable and humane way. Instead, we wait for them to be so sick that they can't deny their issues. And then, as you've heard before, the only access point they have to our system is the emergency room, which still falls to us. And so I think one of my last points I'll make is we talk about putting government in the middle of healthcare, and that this is going to grow government, or this is a step towards socialized healthcare. I guess I would offer to you that in 1984, 86, we passed EMTALA. And that stands for the Emergency Medical Treatment and Labor Act. And that law is what tells hospitals you can't turn people away. If people show up to your emergency room and they need your care and they are acutely ill, we have an obligation by law to take care of them. And so we have a decision to make. We can decide to take care of them in the emergency room, and that care is coming at a cost. And we can ask the hospitals to absorb it and just foot the bill. We can devise different ways to pass a portion of that on to taxpayers, and then all of us can absorb the cost for that. Or we can take a more solid approach and take a preventive lens and say, let's give everyone the opportunity to have a more affordable access place. And so with that, I'm sure I'm over my time, but if there are questions.
Real close.
Yeah, you can.
Just giving you the old.
I saw it in your eyes.
Okay, Representative Baker has a question.
Thank you, Mr. Chairman. Just briefly, if Wyoming were to move down this path, would your organization support things like an independent audit or, Office of an Inspector General to deal with the misappropriation of funds?
Mr. Chairman, I understand your question to be around fraud and abuse. Is that correct? Or would we support, standing up or creating a more robust system to address fraud and abuse? Is that your question? Mr. Chairman, absolutely. Physicians don't want bad actors in their ranks, just like any other profession doesn't. And so if there is evidence to support that we have a problem with that, which I don't think I've seen, but if we have reliable evidence to support that we do have an issue with that, we would be an organization first at the table to try and address it with you.
Okay. Any other questions? Mr. Chairman?
Thank you, Mr. Chairman. With respect to the statement about 93% of dentists accept Medicaid, that's a lot higher than I actually thought. And I've had a couple of emails saying there are quite a few dentists that don't like Medicaid patients. Is that all forms of Medicaid, or tell me a little bit where that statistic comes from?
Mr. Chairman, Mr. Co-Chairman, that was a text message I sent to the Department of Health this morning asking what the physician provider rate was. And in return, they said physician provider participation rate was 99% and dentist was 93%. I don't have any more detail,
Okay.
but I'm sure that they do.
Yeah, I appreciate it very much. 93% still a big chunk of them. Thank you.
Okay, thank you. Any other questions, members of the committee? Thank you so much. Okay, thank you for driving here to Riverton and joining us. Anyone else here in the room want to speak in favor of Medicaid expansion? Okay, we're going to move. No one else here. Okay, thank you. We're going to move online. And so those folks who, we're going to move you from attendee to panelist. I guess we have. You got your hand up. And folks, we're getting late in the day. So, and this is a group that is all in agreement. So we appreciate you joining us and your very succinct and on-point comments. Thank you.
Tell them to look to the chat function.
And we will send you chat messages because we will not be able to talk to you. Thank you. Okay.
Good afternoon, Mr. Chairman. My name is Morris McGaugh. I've lived in Wyoming most of my life, but today I'm here on behalf of the Mountain Health Co-op, Wyoming's newest health insurance company. I serve as the provider network director for Wyoming for this company. Mountain Health Co-op is a member-governed and operated company that invests its profits back into services and benefits like free insulins and heart medications. We've been in Wyoming for about a year now and serve over 2,500 members. We stand today in strong support of Medicaid expansion for the health and economic benefits it would provide this state. It sounds like I'm actually introducing the Mountain Health Co-op for the first time. We are providing services on the exchange. I know I've heard that Blue Cross Blue Shield is the only, but if that's not the case, we are doing that as well. And in the respect for time, a lot of our key points, Sheila and Eric have already kind of explained that and talked a lot about the same things that I would too. So I just want to, extend our support for this expansion and would take any questions.
Thank you, Mr. Chairman. Apologies, but you're an insurer and you're a new one and you have experience in other states. So I love to hear your perspective of whether it has reduced health healthcare premiums for folks in other states that have expanded Medicaid, where you, Mr. Chair.
Yes, Mr. Chairman. I can tell you that in Idaho and Montana, we have the fortunate opportunity to serve members in both of those states that have recently expanded Medicaid. And as you heard Eric speak about Montana, we're seeing the same things, that it has supported the communities. It's better for the providers. It's been better for the hospitals. And we do see it as a strong suit especially in our rural communities. And that's one of the reasons why we're here to support it.
Hello, my name is Maya Gilmore. I'm a resident of Sheridan County. And when I was in middle school, my mother got cancer. The first time she got cancer, I didn't believe that something could happen to me. It seemed impossible that my mother would actually suffer from this illness. And as it turned out, the first time, my mother's cancer went into remission until my first year of college. By the time I was in college, it was a lot easier to believe that cancer and illness could touch my family and even kill my family. My mother has private insurance, and throughout the first incident of cancer was on insurance through her employer. And these days, she's just on a private insurance through the plan. And I thank God for that, because she is still alive today. But there are so many people who are not that lucky. Will you pass Medicaid expansion today? Not today, but this session, in order to save the lives of people like my mother?
Hope you can hear me. This is Chuck Harris. I'm a physician assistant from Teton County, Wyoming, and I appreciate the opportunity to address the committee and the chairman on such an important issue. I'm speaking in support of Medicaid expansion. I have 35 years as a primary care provider and manager of a remote clinic, satellite clinic in Moran, Wyoming. I'm speaking also for my wife, Karen Jerger, who has worked as a medical assistant phlebotomist in both inpatient and outpatient settings. My opportunity as both a healthcare provider and a manager is to be aware of the insurance status of the 40,000 plus patients that we have cared for at the medical clinic in Moran over the last 36 years. This is a patient population who would most benefit from Medicaid expansion and are by definition mostly low-paid seasonal workers, young and old, dishwashers and wranglers, and everything in between. These people that I've met over the last 36 years are often forced to decide between medical care and rent or food or gas for their vehicle, and this results so uniformly in patients seeking medical care much later than they would have done, patients presenting much sicker than if they had insurance and ready access to care without debt, or in some cases where hospitalization is necessary, dealing with the crushing long-term debt that they sustain if they have to be hospitalized. I understand some things about Medicaid, and I understand some things about Wyoming. I do understand the financial crisis for Wyoming, and I understand that this federal relief package would allow Wyoming to finally expand Medicare without a huge investment of state dollars. I understand that there is now no longer a valid financial argument not to expand Medicaid. I understand that the Wyoming Department of Health estimates that expansion would benefit 19,000, 24,000, maybe up to 30,000 of us, Wyomingites. I understand that states have benefited economically from Medicaid expansion. I understand that expansion results in decreased insurance premiums for the general population. I understand this Medicaid expansion primarily benefits low-income workers. Many of those low-income workers, the store clerks, the front desk people, the wait staff, they've been the heroes of this last year. I understand that thousands have lost their employer-based insurance through job loss or lost benefits. I understand as a healthcare provider and a manager of a satellite remote clinic the benefits to patients, clinics, and hospitals if we were to finally take that huge step and expand Medicaid in the state of Wyoming. I understand that expansion will result in a healthier population and a healthier healthcare system for Wyoming. There'll be less uncompensated care, there'll be lower premiums to the general public, there'll be less mortality and less morbidity. We've seen it in all the states around us that have expanded Medicaid. I hope that the committee and finally the full Senate and the House sees the wisdom of Medicaid expansion without additional expense to the state. And I hope so much that the committee moves this bill forward and that our Congress and our state legislature moves this bill into law to make Wyoming finally stronger and healthier. I'm glad to answer questions, and I appreciate the opportunities to speak to you all.
Crap. Okay, can you guys hear me now? Oh my gosh, I'm so sorry. I just got a new computer and still working out the kinks. Anyway, my name is Becky Coombs and I am a resident of Powell up in the northwest corner of Wyoming. And first of all, I just need to say, I think you guys are amazing because I don't even know how many hours of this it has been. And I know my brain's just overloaded and there's been times like, I just want to fall asleep. So props to you. And so I just wanted to start out just saying that I do understand from a Republican point of view where this expansion is not a favorite. I've had the conversation with my dad even about how he doesn't want to give his hard-earned money to everyone. It's his money. And I understand that. And yeah, but I do want to say that, you know, with the federal government providing the 10%, this will not affect Wyoming taxpayers. And I think that this is a perfect time to try the program out and see weigh the benefits against the risks. And then when the program is taken away, then you guys will know, have a more solid answer. I do want to tell my story real quick because like I said, I know you guys are exhausted. I have multiple sclerosis and I was diagnosed in 2002 and I was on my parents' insurance. My neurologist told me to quit college and try to get on disability so I could go on chemo and get on some great meds. I did finish college, but then I did apply and I got on disability and was able to get the medication I needed and see the doctors I needed. And that was 18 years ago. My doctor had told me that had I not had access to the medication and to appointments, I would have been in a wheelchair, not able to move my hands within 10 years. And because of the medication and all the specialists that I've been able to see, I am the chair of a state council. I am a district advocate for the Multiple Sclerosis Society. I'm on the governor's council. I'm joining that for the National MS Society. along with various volunteer activities around my town. Without the medication, I would be in a wheelchair, not able to move, and having someone probably feed me. But oh my gosh, I lost my train of thought. Anyway, yeah, so I'm not. And I see the people who don't have the access. My medication's $80,000 a year, and that doesn't even count it being infused and seeing the doctors and everything else. And I see people who need the medication and don't have access to it. And I see how hard their life is. And I see them struggling so much. And it just tears at my heart. And that is why I'm for this, is I just have such compassion for those who don't have access to healthcare. And that's just a big thing. And so I'm just asking you guys if you guys would also have compassion for the lives of Wyoming residents who are not able to afford insurance themselves. And that's all. Thank you so much for listening to me and listening to my story.
Hi, my name is Angela Sylvester. I'm from Cheyenne, Wyoming. Hello, Senator Pappas and Representative Henderson. I'm a single mom of two, one that has disabilities. I was also raised by a single mom and benefited from having Medicaid as a kid. I was able to get checkups and glasses when I needed them. When I got married and I was pregnant, we were lucky to have insurance when my twins were born. It was pretty easy to keep up with yearly well child checks and get help with ADHD treatment. But around my son's first birthday, he started to show signs of being developmentally delayed. He did not crawl until he was 18 months, and he did not walk until he was 2.5. He wasn't turning sounds into words or doing anything that he should be doing. So we started going to specialists, doing expensive medical tests like MRIs and genetic testing. Medical bills started piling up, and we still did not get the answers or help that we needed, except that he was delayed and that he would need special education. So we stopped going to specialists, and instead we focused on getting through life day to day. But that's all it was, barely getting by. My son couldn't communicate very well. He had behavior issues. He was unable to understand safety when we would take him to public places. The only services he received were through school. We were barely surviving. It was hard, very hard. And the worst part was not being able to give my son what he needed. I didn't even know what he needed at the time. So my son's teacher here in Cheyenne encouraged me to apply for Medicaid. He was approved for Medicaid about 4 years ago, and he was able to get services through the disability waiver. We started on the waiting list and were told it could be up to 2 years before the funding would become available. But when it did, a whole new world opened up for my son and our family. I cannot express enough gratitude for the programs and specialists that have helped him get to where he is today. My son is on appropriate medication. He gets hours of therapy a week, including ABA, OT, PT, and speech. And also the program Be the Change that has been a huge support system for us. And now my son is thriving. He still has challenges and always will. But he can communicate. He has opportunities to go out into the community with his peers. And I have someone that can watch my son and knows and loves him and understands him. Without Medicaid, we would not have known or had access to these programs and specialists. Now, why this makes Medicaid expansion important to me is I personally know of many people, family, friends, and neighbors that are on those same waiting lists. Some who have been waiting longer than my son had to, and many more people who just don't meet the income requirements, and only by a small margin, including me. Now that I am a single mom, I have started to navigate taking care of my kids and trying to take care of myself. I believe that we all deserve to be able to get a checkup or glasses or to get a teeth cleaning. We all want our kids and families to be able to concentrate on the things that matter. To my son, what matters is food, playing outside at grandma's house, and remote control cars. So please vote yes for a Medicaid expansion.
Good afternoon, committee members. I'm Maggie McAllister, and I'm over in Sublette County. I just also wanted to thank Fred Baldwin for your continued support. Hope we'll be able to meet someday over here in Pinedale. I've lived here for almost 30 years, except for a few years that I spent in Colorado. I'm 60 now, and I've been a farmer for the last 10 plus years. I grow food for my community. Here in Wyoming, I had no medical insurance and was not making enough money to get in the health.gov program. So I was hoping to get Medicaid here, but it's of course unavailable to 60-year-old women that have no health insurance. While I was in Colorado, I was even thinking about staying in Colorado because there I was eligible for Medicaid. Last summer, I returned and then I looked at the health.gov, and the insurance I was quoted was $1,500 a month, which was impossible. Luckily, I'm blessed this year that I became eligible for the no-cost health.gov plan, and actually enrolled in that mountain co-op plan, and it's a very good plan. I just secured it May 1st, but I know that here in Wyoming, there are so many others that are not eligible for any type of insurance, or they can't afford it. And there's like 24,000 of our fellow Wyomingites that are not seeking out medical care, or they're going broke with medical bills, trying to just get help and to be well. I don't think that you have to be rich in order to be healthy. You deserve that right. And if you're poor, you deserve to be healthy too. Anyway, I thank you guys for listening to everything that everyone is saying. I urge you to please help our fellow Wyomingites, many farmers, to please sponsor a bill to move forward with expanding Medicaid in Wyoming. Thank you so much for your time. I appreciate it. Have a good evening.
Hello, my name is Rose, and I live in Sheridan County. Hello, Representative Jennings. I'm a voter and I'm a cancer patient. I'm blessed to be 40 years old today, and that was definitely not a given when I was 24 years old. I ended up in the ER with a large tumor on my adrenal gland, and I remember meeting with this surgeon who, we somehow navigated and found this bright young surgeon with talented fingers, and he was super confident and, blowing up gloves to be balloon animals for my nephew when we met with him at pre-surgery. And then I remember him coming into the step down room as I recovered from surgery with my mother, and seeing this man that had been full of all the power of God on earth, completely deflated at the end of my bed. And he told me that I had a kind of cancer that he had never seen before and that he couldn't treat. And I really needed to go find a good doctor that knew how to treat it. And there I was sitting with my mom and all these tubes and wires hanging out of me, and 24 years old, and on my own to figure this out, figure out how I was going to survive. And the reason that I am here in front of you today to share that with you is because, I'm 40 now. So when I was 24, this is before the ACA. And the other thing I remember from that fall is being grateful that it was me that got that crazy thing thrown at them.
because I knew a number of friends that didn't have insurance, and certainly many more that were underinsured through their jobs or with their parents paying premiums for them for, emergency care, basically. And I wasn't in that situation. I had health insurance. I had a job that provided really, really good health insurance. And so I got, I happened to live in a place that had really good doctors for that cancer. And I got connected with them and I got life-saving treatment. I think somebody else mentioned maybe in the counter how we have the best healthcare in the world. And I think, the experts in my very rare disease are in the US. And that is part of our privatized healthcare system, that we have some of that really excellent care. But, I don't really have access to that now that I live in Wyoming. I used to live in New York City, and that's where those experts are. And we don't have access to that care equally. If I had been diagnosed, happen to have a pediatric diagnosis that's extremely rare and more aggressive in adults like myself who are diagnosed. And if I had been diagnosed as a child living in Wyoming, I would not have had access to that world-class care. It just wouldn't have, because our system isn't set up to be equal. So I'm going on a tangent that's not totally relevant. Sorry about that. But I care really passionately about healthcare. And I am here to remind you that the Wyoming Department of Health estimates that 111 of our community members die in Wyoming every single year, which puts the number at somewhere around 1,100 since we first had the opportunity in the legislature to pass Medicaid expansion. And they are dying. Our neighbors, our friends, our family members, our fellow congregants, they are dying every year because you have so far failed to expand Medicaid. They're dying because of poverty. They're dying because they make just a little bit too much to get on traditional Medicaid and not quite enough to get those fully subsidized but federal tax dollars ACA plans. So if federal dollars are good enough for the very, very poor, and federal dollars are good enough for people that make just a little bit more, and federal dollars make up 45% of our budget, then federal dollars are good enough to save our neighbors that are in that gap. And so I am here today to ask you, will 2021 be the year that you stand up and you start saving your neighbors' lives? Vote yes on Medicaid expansion. Thank you.
Good afternoon, Chairman Case and Chairman Harshman. My name is Julie Tucker, speaking for an individual named Sarah Morris. My spoken words will be Sarah's. I was born with the umbilical cord around my shoulder, so that I am a nonverbal quadriplegic. I had been living with my mother, but she died in January. I need help with daily living tasks, such as dressing, bathing, eating, etc. Since my mother's death, my sister and her boyfriend have been doing my care. My sister works nights, 50 hours a week, and she needs help. Without her, I would be dead. I cannot get the necessary home care I need since I've not been able to acquire Medicaid yet. I was advised to apply for Medicaid and its waiver in order to get home care. I started the process on February 6th, and I still do not have it because Medicaid must examine every penny I get. I only get $712 a month from Social Security Disability, which doesn't give me enough to get home care. Because of family circumstances, I was forced to sell the mobile home my mother owned. It was run down, so I could only get $2,000 above the mortgage price, which I then gave to my sister for her care of my needs. Medicaid keeps asking if I sold it for a good price. It was run down and I couldn't afford to fix it. Home care costs $30 to $40 an hour. No one with SSI could afford it. If I were not a person with a physical disability, I would be working full-time. People with physical disabilities should be productive citizens We should not be made to feel ashamed when we must ask for governmental help to live. If our caregivers become ill or die, let us qualify immediately and temporarily for Medicaid while workers examine our income. No one should be allowed to live in poverty to get the care they need to survive. That is the end of Sarah's words. I would just like to say myself, please pass Medicaid expansion so Sarah and other people who are disabled are able to get the help they need. Let them not have to live in fear of something happening to their caregivers. Let dignity be their guide to living in their own homes, not housed in skilled nursing facilities. Thank you, and I stand for questions.
Hi, my name is Danielle Arno. I appreciate your listening ears, and hello, Representative Jennings. I am a voter in your district. Wow, it's been a crazy afternoon just hearing all this. Pretty emotional. I just first want to say that I'm speaking from the heart today about my personal experience with Medicaid, and I find it really difficult to hear when people have theories and opinions about who they think we are, the people that need this help, because I am living it every day. I was born and raised here in Wyoming, and I moved away to get educated and have professional jobs elsewhere. It's pretty difficult. Our economy. Sorry, just muted myself. I moved back here in 2016 after I got my master's degree in public administration, thinking that I would find a good job and I'd be able to raise my son in this good school district. I was wrong. I struggled for the first few years being back here. I'm a homeowner, property owner, struggled with just finding a meaningful job. I was working several part-time jobs, minimum wage. I don't think that I ever made minimum wage even in high school, but was really difficult at that time. Thank goodness my son did qualify for Medicaid because I wasn't making enough money. So he was able to see the doctor and the dentist and prevent bigger things, from happening to him. I then was struggling so much and ready to lose my house that I came up with the idea to go ahead and just start my own business cleaning homes. So with my master's level education, I opened up my own business and started cleaning homes here in the Sheridan area. About 2 months later, COVID hit. I was doing well until COVID, and once the quarantine started and I had to stay at home and homeschool my child, I, of course, was not working. Over that 3 or 4 months of not working and being home, I became very depressed and had never suffered depression before in my life like that. At the advice of my child support worker, I went ahead and applied for Medicaid. They just encouraged me to try to get some mental health help. And I didn't think I could get it because I had applied before. I was in that gap that Rose was talking about, and I was pretty sure that I wasn't going to get it, but because of the CARES Act last year, it did qualify me. So I went to the doctor. I got on some antidepressants. I started seeing a therapist, started getting some therapy. And I am here today to be able to tell you that I truly believe that Medicaid saved my life. I think we think about Medicaid and we hear these stories about physical health and medical help. And I believe in that and I love that. But I'm here to tell you that my mental health was, I was in crisis, and I don't know if I would have been able to make it through last year without the help that I needed. I can tell you that getting Medicaid has not made me more dependent. I am back to working. I am feeling better. It has actually done the opposite for me. It has made my life worth living to have a doctor that I can have a continuum of care with, who knows me, who can prevent things from happening to me in the future. Has made me feel better about life and has given me hope for the future. I just don't believe that being a hard worker sometimes is, I mean, I work hard and I still can't make ends meet. And I do have to choose sometimes between putting gas in my car and what I'm going to put on the table. I'm college educated, I'm a tax paying citizen, and I'm here to tell you that this handout is not going to make me want to work less. Earlier, somebody said people are going to work less so that they can get more insurance. I mean, that is just ludicrous. So I'm an American. We're all Americans. We all deserve to have good health care. We all deserve to live. And I would just ask you, if you don't pass this Medicaid expansion, whose grandson should it be that gets to live? Yours or my mom's? Thank you.
Hello, my name is Julia Willis and I live in Sheridan County. And I just want to say thank you to chairman, chairperson, committee, everyone I'm supposed to thank. I'm really grateful to hear so many people from around the state and to hear from, yes, committee, you've been here all day. You heard from our brothers from the tribes. You've heard from primary care doctor. You've heard from our neighbors to the north what the real deal is in Montana, not some horse pucky from a think tank. Thank you for coming. Montana, I think, is one of the states most similar to ours, and we have that information right there, and we have that support of a program that can help us. So I became disabled when I was 35 years old. I became not unable to work. I didn't know why. It was 3 years until I was properly diagnosed. So in that time, I was not able to work. I had no income. I didn't have Medicaid or Medicare. I didn't qualify for those for 5.5 years after I became unable to work. And I lost my amazing health insurance with my job because my health insurance was tied to my job. We have some really unfair systems in this country and in our state too. When my partner who was, recovering from a bone marrow transplant and another surgery, was driving me to the primary health clinic because I was in so much pain. I couldn't move and I was screaming, literally screaming on every pothole. And I was going to primary care instead of the ER because Blue Cross had started over my deductible, had illegally started over my deductible in the middle of the year. But my primary care knew that I was appealing the decision. These are not the choices we should have to make. I should have been going to the ER in that type of situation. All too many times we are putting off our own health care. Primary care is not optional. You know, a lot of people take better care of their cars. You know, so as somebody spoke about earlier, primary care is not optional. It is absolutely essential care. And we need to be able to go to the doctor when we need it, so we don't die, so we don't become more disabled like I did. I didn't have to get this sick. And I just, you know, I'm grateful that I have Medicaid and Medicare now. It makes a huge difference for my family knowing, having that security, even though we still pay all of my disability income towards our healthcare costs. We're not, you know, we're surviving over here. Okay. And when we're letting at least 111 people die every year in Wyoming, it's unbelievably unjust to me. There are, you know, it's not only financially feasible, there are financial incentives now. We will have more money for our state when we are in crisis. If you had, you know, so many members of your family dying every year, and there was a solution that would make your bottom line safer and would also save your family's lives, like what would you do? Like these are our neighbors. So I just I feel like a lot of people have already spoken to the facts, to how this would financially benefit our state. And I want to remind you that these are real people's lives. I know someone who became an orphan at 13 years old because her mother was in the gap between Medicaid and the Affordable Care Act. And so I would like you to pass this today, and to talk to your co-legislators about how important it is. You have Wyoming lives in your hands today. So please take this opportunity to do the right thing by all of Wyoming. We are not the billionaires. We have more billionaires per capita in our state than any other state. But, you know, most of us are not those billionaires. There is enough to go around. There is enough, you know, and we need to have just systems, and we need to save lives. And that's what this is about. So thank you for hearing me. And I am available for questions.
We've now switched over to this system. Okay,
Can we do a housekeeping on the other bill?
we need to, Mr. Chairman Case.
I want to make a housekeeping amendment, and that's that we're not going to take up the next topic. So anybody that's online or what have you, we'll kick that can down to the road, at least to the next meeting. So we will not take up the revenue recovery through workforce protection. We've tried to talk to everybody that was here for that. We'll just work that in probably at the next meeting, but during the interim. Thank you.
Okay. Okay, members, we're going to close public comment. Appreciate everybody who has traveled here. Particularly, we're in this kind of hybrid world now. Appreciate folks who stayed with us online. We had some trouble. Give each other a little grace on this that we can move forward, but appreciate everybody's participation today. So we're finished with public comment. Really now we're at that point about committee directives and just really where's the committee want to go with this? And so, Mr. Chairman, you have any?
Well, Mr. Chairman, I move that we take up the bill from the session, the House Bill 162, as it was engrossed, as your body made the changes to it and it came to the Senate. And I move that we use that as a starting point and have any additions to that bill if we can. It's a simple 3-page bill, and I look for my second.
Second Representative Henderson. Senator Baldwin, okay. Okay, so first of all, then any discussion on that, we'll vote whether we want to take that kind of as a vehicle to move forward. Representative Gray?
Thank you, Mr. Chairman. I'm going to be voting no on this. This bill is really not in my values. And, first I want to go through some of the issues here. One, that it's very clear we're not going to be able to get out. FGA had a citation of the federal law here. I could pull it up, and it's pretty clear to me that it's a no. Once a state is in, they're in. And also I'm very concerned about coverage of abortion and transgender surgery. I think the testimony from Ms. Craven about the Montana experience, I think was very powerful. Medicaid, that specifically that testimony about expenditures rising, state expenditures rising, Medicaid expenditure as a percentage of state expenditure from 17.4% to 26.4%. I think the hospital experience, we've gotten into the back and forth on that. But at the end of the day, I can't get over the circularity of the fact that the current Medicaid program is part of the problem with hospitals' bad debt, but somehow the solution to that is expanding Medicaid. And I don't see the data there saying that it is the solution, just a guarantee. And frankly, the guarantees that we've heard on this, like 4 years ago when we heard that that was the best deal we were ever going to get on this, ever. And it's just the track record. And the reason I bring that up is the track record's not there from the groups that have been pushing this, that this is a big change, and the credibility gap between some of the statements from groups that just really want this to happen and the reality on the ground is not there. And I think that actually came out in some of the Department of Health testimony. I think even they understand that the bill of goods that has been sold on this is not there. And they were very careful in couching some of what they said. The other thing too, I'm very concerned about the committee it's in. This is a labor health topic, in my opinion. And you look at the makeup of the committee based on former votes, it's a 7-7 proposition there, which would fail. On this committee, based on former votes, it's a 9-5. And I'm not getting in anybody's head why it's here, why it's not, but I'm very troubled by that. And that's the reality. It's the reality of the makeup of the committees. And I don't think it's appropriate in this committee. I think it's inappropriate that the projection was limited to 2 years in the Department of Health study. And at the end of the day, we get into this, but I'm opposed to Obamacare. And I think about some of the things that inspired me to get involved in trying to help my country. And that was a really pivotal moment, was the passage of that. I believe it's unconstitutional now. I believe it was unconstitutional then. And I don't think it's consistent with my values. And so I'm not into participating in that and signing that check that I don't think we're going to be able to pay for. I think that question has never been answered, how this is going to be paid for down the line. And it's just, as a fiscal conservative, as a conservative, it's really inconsistent with the direction I think our state should go. So I'm going to be voting no. Thank you.
Okay, are there any more comments before we take our vote and see whether this bill's going? Okay, Mr. Co-Chair.
Mr. Chairman, thank you very much. I too am kind of disturbed by the quality of the testimony that we've experienced. And let's just kind of run down from the top. Talk about Montana. Okay, we heard Montana's been a disaster. Montana. Well, the hospitals in Montana think it's good. Other folks in Montana think it's good. Montana seems to be good. We heard that Utah was bad. Utah's experience seems to be good. We heard that we can't get out of it. We can't get out of it. I'm looking at the frequently asked questions on the CMS's website. Question 25, if a state accepts the expansion, can a state later drop out of the expansion program? Question mark. Yes, a state may choose whether and when to expand it, and if a state covers the expansion group, it may decide later to drop the coverage. That's the answer. That's what the Department of Health testified here today. Unequivocally, that we can get out of it if we wish. We heard from testimony that Medicaid medical professionals do not support it. We have two of the largest organizations representing medical professionals and hospitals in Wyoming here today testifying that they support it. The Hospital Association supports it. The Medical Society supports it. We've heard from practitioners that support it. Mr. Chairman, the next one is the toughest one for all folks, and it's the abortion issue. We've heard that Medicaid expansion will lead to elective abortions in Wyoming. It's the case of Alaska is cited, which has a different makeup of their legislature and different choices that they made with respect to abortion policy and funding. Clearly, this legislature, I've paid attention to the movement and the successful efforts to restrict abortion in Wyoming, and you got the votes. You got the votes clearly. And those votes also mean that you control whether we participate in Medicaid or not. Should any policy change with respect to federal policy, federal mandates, what have you. It is disappointing to me as a long-term member of this legislature to hear so many falsehoods from the same people over and over. I have never experienced it quite like this. And it kind of is a signs of our times where people, they get something on the internet and then you see the same thing from 5 different people, but it still doesn't make it true. This is a good deal for Wyoming. It could be a good deal. We can't even start to figure it out until we pass this bill and go forward. So that's why I'm urging us to pass it. I'm urging us to pass it for the special session. And if we don't have a special session, I'm urging it to be passed and introduced into the budget session. There may be some other amendments we wish to make. And Mr. Chairman, I think you've done some thinking about that. But, it's time to get this over with. This committee took it up 2 years ago. We passed a bill. I do certainly agree that there is strategic issues with respect to committees. Everybody knows and can count votes, especially in the Senate, with the number of committee members and how it goes. This is an important issue for Wyoming. We have given it the most thorough consideration that any committee ever has. And the results are that we should do this. We should do this because it's good for Wyoming. It's good for our Wyoming economy. But it's most importantly, it's good for our Wyoming citizens.
Okay, any other? Senator Schuler?
Thank you, Mr. Chairman. Just a couple of different things. I think this has been a really educational day. I appreciate all the testimony. Learned a lot, even more than I used to be on labor health. So heard these things before, but I appreciate all the work that our Department of Health folks did. I think they presented things today in a really unbiased, very neutral way, just threw the facts out there and let us kind of, wade through the waters and see what we came up with. Appreciate all the folks that testified online, as well as some of you have been here 2 days, and it's a long 2 days. But this is an important issue, and I actually, was not real sure where I felt about it, what I felt about it. I ended up going to a Medicaid 101 conference, and I learned an awful lot there. I think there were about 20 states, maybe 22 states there. And I wanted to go and ask them, what did you think about it? How's it helped your state? And really the bottom line is there was only one state that was there that felt like it hadn't been a good thing for them. And it was because they underestimated their numbers, which has been mentioned today more than once. So, out of all of those states that have gone to it, and a lot of them talked about the economic benefits. And so even though I believe that the health benefits are certainly the number one thing here, I think it is an economic driver. And I just was pulling up the economic effects of Medicaid expansion in Montana. They found that it introduced $650 million into their economy since each year. It supports 6,000 new jobs and 400 million in personal income. So when we say that it shouldn't be at the revenue committee, I think maybe this is actually not a bad place for it to be, because we do need to take a look at trying to find a few more buckets of money for Wyoming. And I think Medicaid expansion could be that. I don't think it's the end all be all. And I would be interested in, and again, seeing if there's anything we can do to tweak, if this bill does go through, we can tweak it, make it better, make it so that it's something that we all feel good about. But I'm definitely on board for it. And I just wanted to mention it. Thank you, Chairman.
Senator?
Thank you, Mr. Chairman. I'm sorry. I haven't used this thing in 2 days. I didn't know for sure how it worked. I just felt like I don't want to belabor this too much, but I felt as chairman of Labor and Health, I probably needed to weigh in on this. And one of the witnesses today talked about how many hours we spent talking about this. Well, I can tell you that I've listened as many hours as anybody in this room, perhaps more. Back in the days of Chairman Harvey in Labor and Health, we spent some late night hours on this bill, as well as other bills. But since that time, I've heard many, many hours of testimony. Some of it was the same. Some of it was the same we heard today. Some of it was different. Some of it was new. The new part is an improvement. Just to explain my vote, obviously I'm a yes vote. I think this is the right thing for Wyoming. I think it's the right thing for Wyoming hospitals. But most importantly, I think it's the right thing for our citizens that are most in need right now. And we have a lot of those. It says 22,000. That's a guesstimate. It could be 18, it could be 30, or perhaps more. But the fact is we got people that need insurance, they need the health care. And I think some of the unseen things that we're not discussing a lot is when we improve these people's health care, we improve the state. We improve the productivity of these people that need the insurance. And it benefits us in many more ways than one. It benefits the economy more than just the money that comes from the federal government. It benefits by our economy by putting these people to work, getting them back on their feet. One of the testifiers today talked about she couldn't do anything. She'd be in a wheelchair now, being fed. There's a lot of those people out there that we're going to make more, not necessarily useful is not the right word, but more able to perform, more able to do the things that they want to do. And I think that's an important concept that we sometimes overlook. So it's not just the economic benefits, that's a big piece. But the bigger piece is the piece that we improve the attitude, we improve the quality of life, and we improve everything for Wyoming citizens with this. It's not a silver bullet. There isn't one. We've been looking for years. And the silver bullet's not there to make everybody's life perfect and to provide perfect mental health or health care for everybody. It doesn't exist. We're looking for it on another committee. Representative Larson and I served together on Labor and Health. We were looking for a silver bullet then. We're still looking. We're on a committee now looking for closer to a silver bullet, maybe a bronze bullet. But I think this is an important step. I certainly support it. And I think it's something important we need to do to move forward. And I welcome this on any committee I'm on. This follows me around. Revenue, labor, and health. It's my personal mantra. It's on my shoulders all the time. So I will be a yes vote, and I encourage yes vote. I think it's important.
Okay, thanks, Senator. Okay, anybody over here? Okay, anybody represent Jennings? Go ahead.
Thank you, Mr. Chairman. So I'm going to not echo all of Representative Gray's reasons that I would pretty much agree with, but I'd like to point out that I don't think because you're not thinking that this is the correct vehicle, it doesn't mean that we don't have a heart or that we don't care about the citizens of Wyoming. We just see that this is a dangerous vehicle and we don't believe it's the right vehicle. It doesn't mean that we don't agree that we'd like to see things be better. And that's really one of my largest concerns, and I brought it up. There's alternatives to this, and we've not taken a serious look at those alternatives. We've done a few things here and there. We've not gone back and looked at how they're working and how we could make them work better. And so I just look at this as there's special interests that have wanted this for a lot of years. And I get that there may be some benefit in areas of this. I also get that there's alternative things that we could and should be exploring also. So I'm going to be a no.
Or anyone else before I move to Senator James has his. Okay, Representative Yen.
Mr. Chairman, just briefly, I think the confusion from my colleague that providers must not be, that there's for some reason that if we expand Medicaid, that they aren't going to gain money is really made very clear by the modeling from the Department of Health. Modeling from the Department of Health says that even the people that are on private insurance right now, if they switch to Medicaid expansion, providers still get a net profit benefit. And it's very confusing that we see that there's still insistence that is the case. So ultimately, I would say that we've heard from testimony that the second order benefits are great, that people become more productive by ensuring that they stay healthy and able-bodied, so they don't wait until they go to the emergency room and essentially become unproductive members of society if they can't get healthcare, access to healthcare. But the net profit benefits to our rural access hospitals is very important, because ultimately, if we just lose those hospitals, we're also going to have a real problem in each of our communities. So I think now is the time. It was the time, honestly, 7 years ago, but might as well do it now. Thank you, Mr. Chairman.
Okay, thank you. Are there any other before we're going to do the little mic swap and we're going to, okay, so I'll turn my mic off.
Thank you, Mr. Chairman. I just have two main concerns. Number one concern is the waste, fraud, and abuse dealing with Medicaid, as echoed earlier by Mr. Gaskell. My main concern with that is he was the main investigator that dealt with the federal case that Wyoming failed with. And, he mentioned that him and his wife were both fired once they figured out, once they solved that case. And so, my question is, if they did such a good job with that, why were they fired? My second question, my second issue is, we've asked numerous times for the federal code dealing with us being able to get out of Medicaid expansion once we got in. And the Department of Health said they had a verbal communication. And yes, it may say on their website, but I'm of the belief that trust but verify. And we haven't been able to verify yet. We may trust them, but we haven't been able to verify that federal code. And I haven't been able to look for it. And I've been trying to find it everywhere. So I want them to be able to bring it to us by the next time we have our committee meeting. I want them to be able to present it to us where that federal code says that we can get out of there with no restrictions. So if that could be presented to us, that'd be nice. And but the waste, fraud, and abuse is also a big issue that we definitely need to get a handle on, because if we expand this, it's only going to get worse if we haven't solved that problem. Thank you. And I will be a no vote.
Hey, mic's on. Okay, members, Mr. Co-Chair.
Well, a couple of things. I want to be clear that this is a vote to introduce this into the special session, should there be one. And if it's not the special session, it lays in our docket and it comes in at the first opportunity at the regular session or the budget session.
So we're voting, the motion is then to adopt this 162 as it was engrossed, let the House of Representatives as a committee bill. So,
Correct.
okay, Representative Gray, question.
Mr. Chairman, thank you. I want to just clarify this because typically I've been in the legislature 5 years, I understand not as long as Senator Case, but typically there's usually 2 meetings to introduce a bill. You have the bill draft motion and then you have the bill in front of you. So I want to be clear, this motion is to not only to draft a bill, this is a motion to have the sponsorship. So it's one motion for the whole thing, correct? Because I'm not seeing a revenue meeting scheduled before the special session. And so I just want to understand this. I was under the understanding originally with the motion, I'm no either way, but that this was probably a bill draft motion. But now based on those last comments, it appears I may have been mistaken. So just want to understand what we're doing. I'm no either way.
Mr. Co-Chair.
Sorry. Mr. Chairman, our mandate from Management Council, we presented this as the first priority and the idea that we'd have it done for the special session. This may be our only meeting for this before the special session, so this is our only opportunity. It's a 3-page bill. It's the exact same bill that all the House members have already seen and part of our Senate committee has already seen as well. So it'd be a roll call vote. The motion would be to put it in the special session, and absent the special session, which may not occur, nothing's for certain in this world. It would stay on our docket for the budget session. I will point out that until we actually get to a session, it remains within the purview of the committee, so that if the members wanted to amend it or anything during the course of the interim while we still have possession, then we'd be able to do that. But yes, indeed, it'd be a roll call vote for introduction into the special session. And that's kind of our insurance policy in case we don't have another meeting, or even if the special session doesn't occur, it would be in the budget session. I hope that I'm clear.
Okay, I think you are clear. Are there any other questions? I know you're aching to vote. Representative Jennings. I have several items I'd like to add to this, but I don't think I'm going to amend it today just because the hour is long. And I mean, most of what's in there is the 90-10 and the 55-45 FMAP. That's a key part, I think. Obviously, we already know that the 1985 law that 35-6-117 applies to that. No state dollars for any elective abortion. It's been on the books now for, going on 40 years. And so that's already a part of that. I think, something I'm going to be interested in really, I think, are these offsets. And that was really about 7 years ago was our idea. Department of Health came to us with savings in other areas. And we have dropped Medicaid programs, PACE programs, Medicaid program we dropped. So some of those programs come and go, absolutely. But anyway, that's another subject. But I'm not going to make any amendments today. I think members certainly could if they want. But we haven't even taken the vote yet. So the vote to sponsor. Any other questions then on procedure? Be a roll call vote. Okay, I think we're ready. Is there a question being called? Question being called. Who will call the roll? Is it Josh? Thank you.
Okay, Mr. Chairman, this is a vote to sponsor House Bill 162 as engrossed from last session as a revenue bill.
Either in the special session or the budget session.
Correct, Mr. Chairman, either in the special session or in the budget session. Senator Baldwin. Senator James.
No.
It's a no. Record him as a no.
Senator James, no. Senator Pappas.
Aye. Aye.
Representative Baker. Representative Gray. No. Representative Hallinan left a proxy vote of no. Representative Henderson. Representative Jennings. Representative Roscoe. Representative Sweeney. Representative Yin.
Aye.
Co-chairman Case.
Aye.
Co-chairman Harshman. That passed, Mr. Chairman.
Any other action on that bill? Mic on? Any other action? Did Representative Hallinan leave a proxy vote?
He did. It was no.
He did, Mr. Chairman. I counted him as a no vote.
Okay, thank you. Okay, that's clear. Very good. Okay, members, any other action on this bill today?
Let's go home.
Seeing none. Okay. Any other items before the committee? We're going to move this last topic. We've informed all those folks who are online waiting on it. We're going to move that to a future meeting.
Mr. Chairman, we should do some public comment. There might be general public comment.
Hi, Lexi.
Anyone here would like to, for the good of the order? Any comment? Okay, members? I just, as we wrap this up, appreciation for our Legislative Service Office staff, the staff here at Central Wyoming College, Wyoming Public TV. Appreciate all your good work, and we're all these new challenges. We're all learning every day. Appreciate everybody who actually drove up here to Riverton, spent the time with us here in beautiful Fremont County, and all the folks who joined us online. But our LSO staff, really appreciate, I think we were the first interim committee meeting out of the gate. And so the heat was on, and man, the education topics you put together yesterday was really, truly great, and really appreciate it, and appreciate all your hard work. So everybody, safe travels back home. Watch the critters, as our friend Richard Garrett would say, and never swerve on a jackrabbit. And okay, so until we meet again, thank you all, and we are adjourned.